I'll be back out. Yeah, I'll get back out there.
You're ready.
Yep.
All right, we ready?
Rock.
All right.
Welcome to the Mason County Board of Health, August 4th, 2026 meeting. Let's do introductions. I'm Eric Onisco, City of Shelton, and the current chair.
Dave Wyndham, Mason County Public Health Director.
Randy Nevlin, Mason County Commission. Pat Tarswell, Mason County Commissioner.
Peggy Van Buskirk, Hospital District 2.
Pam Schlotteroff, Hospital District 1.
Sharon Sherman, City of Shelton Mayor, and first time at this meeting.
Welcome.
Thanks.
Desiree White, Skokomish representative, first time here.
Welcome.
Nice.
Emily Hearn, I'll be presenting, and I'm with Lewis Mason Thurston Area Agency on Aging.
I'm Brett Wilhelm on the Board of Health.
All right, staff? Staff here?
Right behind
so
you.
behind.
Oh, hi.
Go ahead.
Ian Tracy, environmental manager.
Melissa Casey, community health manager.
All right, is that it? That's it.
Sunny Evans,
Oh,
environmental
sorry.
specialist, food safety. Good morning.
Alejandra Brown, public health.
Got it. We got it? Cool. All right, we're at, there's approval of the action agenda. Is there a motion to approve?
I make a motion, we approve the agenda as presented.
Second.
All right, motion is second to approve the agenda as presented. All in favor, say aye.
Aye.
Opposed? Motion carried. We have no minutes to approve today. And we have presentation of the Washington CARES Act. Oh, wait, I skipped public comment.
Yeah.
So, is there any public comment that's not on the agenda today?
It's not ask them. So, hi, my name's Constance Simpson, and I live in Union, Washington. And from past meetings, I understand the protocol for public comment is that I can ask a question, but it's not going to be answered. So, but I do want the minutes of this meeting to reflect that I requested the following information. The current members of the Mason County Board of Health, what positions they fill, and who they represent. And I would appreciate a response, by next Wednesday. So I have a copy of that request to Eric.
Do you have a copy?
Okay, I can,
Oh,
you want to give me yours? I wanted to give
I got
it
it,
to
I got it.
the clerk of the board.
Okay.
Here. Thank you.
Got it.
Thank you.
I'm Ryan Finn with Taxpaying Citizens of Golden Pheasant. There's a draft code change being discussed today. I had sent a letter, so I'll keep it brief. A couple of suggestions for how to improve the draft. There's suggested changes to Mason County Code 604040. That's the enforcement clause on the sanitation code. I think the language is a bit weak. I think it could be stronger. I understand what's trying to be done here to modernize the language. I think the way it is written, it's excluding tools that are available for enforcement. You don't just have either they deny your ability to come onto the property or you get a warrant. There's things like fines, revocation of permits. I'm afraid that the way the wording is, it locks people into either not doing an enforcement because they denied your access or doing a warrant process. Perhaps I've offered some suggested language. Perhaps it could say any tool available up to and including a warrant, but simply stating just we will pursue a warrant suggests that some of the more minor code enforcement complaints might not get investigated because they just don't warrant that, pun intended, that kind of effort, that kind of expense. More importantly is the penalty clause. So I believe the intent originally was to modernize outdated RCW links because they've been changed over the years. And I'm guessing that originally back in the 70s when this was written, the RCW that was originally cited, I believe the rest of the language that's in Mason County Code that's in quotes must have been at that RCW. It's not there any longer. There's no penalty provision at that RCW or any of the sub-referenced RCWs. They now deal with people who refuse to be treated for STDs, doctors who refuse to report patients who have communicable diseases, and then improper behavior on boards of health or health officers. There's nothing at all about a penalty for someone who violates sanitation code. So I would suggest taking the language that was there in the 70s and maybe discussing tweaks to it. Obviously, the fine $25 might have been a lot in 1979, but that's nothing today. So there might be a better discussion, but omitting that language in its entirety would basically eliminate any penalty for violating the code. There's some other suggestions about housekeeping things. They're creating a new appellate, like you can appeal to the Board of Health what the health officer's decision is. It probably should be inserted into the appellate hierarchy instead of being a separate process. The way it reads now, someone could actually jump to suing the county while appealing to the Board of Health at the same time. Seems inefficient. Probably would be better to have them go to the Board of Health first before they can go access their judicial rights. And just a few other housekeeping items that are in the letter. It's a draft, so I suppose debating changes is what the point is. Want to end on a positive note. I remember that a few months back, there was discussion about the needle exchange, switching to one needle in, one needle out. I can report that on Golden Pheasant, where I do the Adopt a Road cleanup, we dropped to 1 needle 2 pickups ago and 0 needles on the last pickup. So it has had an impact, at least in our corridor. So thank you for that.
Thank you. Is there any other public comment that's not on the agenda? That actually was on the agenda, so. Is there any other public comment? No, all right. Now we're at our presentation. Emily.
Hi, let me share my screen here. And want to make sure, can people on Zoom hear me? Can you get a nod or something?
Yes.
Thank you. Hello, I'm Emily Hearn. I work with the Lewis Mason Thurston Area Agency on Aging with the Walk Cares program. My official job position is Benefits Navigator. But as the program has got a bit of a slower rollout, we also are throwing outreach duties onto our job description. And so I'm here to talk about Walk Care's basics. Oh, come on, I clicked the screen, didn't I? There it goes. All right. So basically, families need a better way to pay for long-term care services. And public insurance programs like Walk Cares, it gives workers a more affordable way to pay for long-term care services like in-home caregiving, home-delivered meals, home modifications, incontinence supplies, and assisted living facilities or nursing homes. So what people do is Walk Cares moves the cost to paying for long-term care to years when an income is higher during their working years. They contribute while they are working only, and then they can access the money later on if they are on a fixed income, like on disability or Social Security. All workers contributing, it keeps the premiums low. And once you're no longer working, contributions stop. So you don't have to keep paying into it if you are not working, either taking a break from employment, you're injured, or you retire. It is more affordable than private insurance options right now for long-term care insurance. Plus, it is also very difficult to get qualified for those plans as well. There's also no out-of-pocket costs for 90 days that sometimes private insurance options have. There's no deductibles to use it, there's no co-pays, and there's no waiting period. So how it works, so most Washington workers already contribute, and they contribute 0.58% of each paycheck during their working years. Contributions began in 2023, and it shows up on your pay stub as the Walk Cares tax. And again, you only contribute while you're working. Everyone's covered at the same low rate, regardless of pre-existing conditions. And, there are 2 requirements. There's a contribution requirements, meaning you have to contribute enough to the fund to qualify. And then also you need a care needs requirement, which we'll go over a little later in the presentation. And then once you're approved, you get to choose how to use the money. It's not someone saying, oh, you want to do this, you have to get approval for this, you have to go to your insurance company to get approval, or you have to wait this period to be able to use the service. No, once you're approved for Walk Cares, it is yours to use. Either you can use the full amount, or you can just use a little bit and then leave the rest for later. And the full lifetime benefit amount right now is $36,500, and it will grow with inflation. It'll be adjusted each year for inflation. And again, no out-of-pocket costs. There's no co-pays, no deductibles, nothing. And it's affordable contributions across your career. So you can see like the typical worker who participates makes about $59,000 a year. And so that'd be contributions of around $29 a month. And over 30 years, they would put in like $10,260, but they have access to $36,500. I mean, in order to put more in than you would get, you'd probably have to make over $200,000 a year for 30 more years. Most Washington workers do contribute, but there are some who are not included. So obviously people who don't work in Washington. Federal employees, because they work for the country as opposed to the state. Temporary workers on non-immigrant visas. Self-employed workers are not automatically required to contribute. It's not one of the required taxes, but they can opt in. Employees of tribal businesses, if the tribe decides to opt in, then they can participate. But most of the tribes have their own program anyway, so that's why they're exempted. And then also people who had a private long-term care insurance program already, that they're already paying to. They could apply for an exemption back in 2023 when the contributions started. But they can also opt in if they want to just add more coverage, because honestly, long-term care is expensive, and the more coverage, the better. Those who can apply for exemptions are workers who live out of state, spouses and domestic partners of active duty U.S. Armed Forces, active duty service members with a civilian job, and veterans with a 70% or more service-connected disability. Now for self-employed workers, they can opt in and they can get the same affordable benefits available to every other Washington worker. And they contribute, again, that 0.58% of their net earnings and gross wages. They have to work 500 hours per year to earn the benefits, and that equates to only about 10 hours a week. To opt in, they need to opt in within 3 years of becoming self-employed for the first time. And then there's that website there to get more information about opting in. You can do it on the Secure Access Washington website and going to Paid Family Medical Leave Service. There is the contribution requirement, so there are 3 pathways right now. The permanent pathway is if you contribute 10 or more years to the fund. And 500 hours, per calendar year. Now, obviously, nobody qualifies for this pathway yet because we've only been taking contributions since 2023. So, for now, we have the temporary pathway. If you contributed at least 3 of the last 6 years at the time you apply for benefits, you can access the full amount. And then we have a transition pathway for those born before 1968. If they were retired in 2023 or 2024, they can receive a prorated percentage of the full amount, 10% for each year contributed. So if they retired in 2024 and they put enough hours in 2023 and 2024, they could get $7,300 because they still contributed. The next requirement is the care needs requirement. So you need assistance with 3 or more activities of daily living. And we have those activities here listed. So bathing, transferring, so that's getting up and down and out of a chair, mobility, getting around your house, medication management, so remembering to take your medications, remembering your dosages, and remembering also to get them refilled. Toileting, and then bed mobility, how someone, when they're already in bed, moves around, can get comfortable, adjust their pillows or blankets or whatever. And the last one is eating, and that's the actual physical act of eating from plate to mouth, not meal preparation. Yeah, not that one. Sorry. To apply for benefits, we have a website here you can follow, but it is on the Secure Access Washington website, and you add the WaCare service, and you can just automatically submit your application on there. Or you can also get what's known as an annual statement to check your contributions to see if you have contributed enough and if you meet that requirement. Once that's confirmed, that history is confirmed, someone either from the state will call to schedule an appointment to talk about your care needs, and then also to schedule an assessment, which is usually done at your home to see, what you need assistance with and how you are handling your activities of daily living right now without help. And then get approval to use your benefits. Now, also for the care needs requirement, it is very easy to qualify. Supervision only counts as assistance required. So that covers people with cognitive disabilities, or impairments. And we don't score how much help you need, like if you're applying for Medicaid long-term care. It's only, do you need assistance or no? And then if it's yes, then we click it, it's just yes, and 3 or more, approved. For those who struggle with navigating the system, or if they don't have the cognitive ability to do so, they can have someone else manage their account through an authorized user function in there. Also, people can upload either power of attorney or guardianship documents and be able to navigate it for the person that they care for. Also, you can call your local area agency on aging for expanded assistance. If you're struggling navigating the system, it's designed to be self-serve, but we do understand that sometimes it can be difficult and confusing. So you can reach out to us for that expanded assistance. And you can use your benefits for any covered services, things to help you stay at home, like in-home caregiving, either through an individual provider or home care agency. And a big difference too with this program versus Medicaid long-term care is that with Medicaid, you cannot have your spouse be paid to be your caregiver, but with WaCares, you can. You also have home safety evaluations done, like this would be if you're coming from the hospital or from a facility after being injured or recovering, and you want to make sure your home is safe for you while you're recovering or just trying to stay home again, and someone will come to the house and check to make sure it's safe. Also, there's home modifications like ramps, grab bars, widening doorways, and other things just to make home more accessible and stay home longer. There's home delivered meals, transportation services, adaptive equipment and technology, personal emergency response systems, and also housework and yard work. You can do cover services that support your family caregiver, paying a loved one or a friend or a family member to be your caregiver, respite care so that your caregivers can get a break, education consultation, there's other supports for dementia and behavior, and care transition coordination, such as if you're, again, leaving a hospital and you're coming back home. There's a service that helps you plan for all that, the care and everything you need to be safe and to manage your recovery. Also, adult family homes, adult day services, and assisted living, nursing home, and memory care services. So here is the question is, well, how far will my benefits go? Is a little bit of a breakdown of an estimated cost of a few different services. First one is like paying a family caregiver for 10 hours a week for 2 years is about $31,000. And care supplies for like incontinence products for 2 years. Oh, excuse me. There's also home accessibility, so home safety renovations. This estimate here is for building a ramp and widening 3 doorways, about $8,000. Personal emergency response system for installation and 3 years of service, running around $3,000. And weekly meal delivery, 10 meals a week for about 3 years. It's about $24,960. And then there's some temporary support estimates on the right there for hiring a part-time caregiver $23,400 for 20 hours a week for 6 months. Home modification ramp and safety equipment. And down there at the bottom of those estimates. And remember, these are estimates and don't guarantee the cost of any of these services. It can vary based on your area of service and other factors. Now, getting more coverage, this is one of the things that's kind of exciting to me. WA Cares is limited, long-term care is expensive, and $36,000 will not go very far. It is better than zero, I'll say that, because right now a lot of people don't have long-term care coverage, and it's not covered by health insurance. So I'd say better than zero. But people might want more coverage. Either they need more time, they need longer care, or they have to move to a more expensive facility. The legislature has created standards for supplemental policies that work alongside WA Cares. It's similar to Medicare, a public foundation, but with private options for those who want more coverage. And they kick in seamlessly after using WA Cares, providing more options for plans and prices, but it still should be more affordable than what's out there right now. One big reason is that if you use your WA Cares fund before your private insurance plan, that will count as your deductible. So it's a big cost taken out right there. And also more consumer protections have been added. So May of 2026, the Office of the Insurance Commissioner finalized all the rules, and policies should or could become available in early 2027. Another cool feature is that you can take the benefits out of state. So you can continue participating after you leave the state if you have contributed for at least 3 years with that 500 hours per year. And you opt into the program within 1 year of leaving, and you keep contributing during your working years. So there is currently work being done on the process for reporting and paying premiums, and people can access benefits starting in July of 2030. So we're from that process, also working to find providers. Oh, one thing I noticed. So in picking providers for long-term care, the only stipulation is you have to find a provider that's been contracted with the WA Cares program, but there are a lot of options out there. And they're all available on the Community Living Connections website. And you can find the directory for all the WA Cares contracted providers. Now this program, it's a cross-agency effort here. So there's the Department of Social Health and Services, which processes applications, determines care needs, and provides provider registration. So they go out to providers, get them registered, get them signed up for the program. The Employment Security Department collects wage reports, the premium payments, they manage exemptions, and they also make the contribution determination, which thankfully is very quick on the SAW website. You just hit it, and usually, unless there's a bug or an issue, it comes back within less than a minute. The Healthcare Authority, so that handles provider payments. So all provider payments are done through Provider One. The cash isn't just given to the beneficiary. It's the provider makes a request in Provider One, then the beneficiary goes in and approves it, and then Healthcare Authority pays them. We also have the Office of the State Actuary. They do ongoing financial analysis of the program, and currently right now it is extremely solvent. So through 2070 at least. So we're in a good place financially with the program. And then one which isn't on the slide right now is the local area agencies on aging. Again, they understand that people may not be able to self-serve. They need expanded assistance. So they contracted with area agencies on aging to be able to do more face-to-face, in-person help with a beneficiary applicant who needs that assistance. And we can do everything from, talking about the program, helping them apply for it, doing that call to talk about their needs and doing the assessments, and then also working with them afterwards to pick providers and manage their benefits. All right, that's the end of the presentation. Any questions?
Thank you.
All right. Questions? So you can take it out of state when you move, and when you retire and you qualify, you can use it out of state.
And you don't necessarily have to be just retired, so this isn't only for older folks. As a matter of fact, most older folks don't qualify because contributions only started in 2023. And if they've already retired, they don't qualify. One example I like to use, if I, heaven forbid, went out and in my car and I got in a car accident, got a spinal fracture, and I needed care at home, I can apply for this program and I can use it. So it's anyone 18 plus can access these benefits as long as they meet the contribution and care needs requirements.
And make within the first year that they opt into that.
If they're leaving the state, yeah, if they left the state. We're also working on finding, other providers out of state because they have to be contracted for it. But I mean, Washington's kind of being watched right now by the rest of the country for this program, because long-term care is a big issue. And we've got 3 big generations going into senior age and middle age who are probably gonna need it. About 70% of people will need long-term care sometime in their life. And it's not covered by health insurance.
Are other states already doing a program similar to this?
There's studies going on. I am not sure exactly which states
Take the
are,
conversation outside.
but yes, they are doing similar to what Washington started, 2014-ish, where they started putting committees together to look into these kinds of programs. Because again, it becomes expensive, especially on families. My mother-in-law passed in December, and my brother-in-law and his family shelled out about $100,000 during the last few months of her life for her care. I mean, thankfully they could cover it, but not a lot of people can. It's a lot of money. And most people don't think about it until they need it.
All right, any other questions?
Just a comment, I do the left board here, and just local right here for assisted, not even hardcore, is between 10 to 15,000 is what we're paying
Yeah, it's
per
expensive.
month.
Yeah, yeah.
So that doesn't provide much.
It doesn't provide much, but it's also not zero, which is currently what most people don't have. And also there's no income requirements or asset requirements like Medicaid. You don't have to spend down your assets to below $2,000.
Isn't the income requirement that you pay into it?
Well, that's it, but like with Medicaid, you can't make a certain amount every month. And your spouse can only make a certain amount to qualify for Medicaid long-term care. Also, a lot of people hesitate because if they own their own house, they don't wanna have to go through the estate recovery afterwards. Cause they wanna leave the house to their kids or something. But what happens is after they pass, then the state comes in and recoups the cost of their Medicaid long-term care by selling the house and taking it. Again, that doesn't happen with WACARES. It's not perfect, and it's not a whole ton, but it is not zero. And it could be things that, again, keep you in your home longer, so you don't have to be spending all that money in a long-term care facility or a nursing home. Again, those simple modifications to your house. You can get modifications to your house through Medicaid, but it is a difficult process. Whereas with this, it's, oh, here's a provider, here's a contractor who's working with WACARES, which I could say Rick Johnson, a local contractor company here, is contracted with us. He's great. But they can come do those modifications to your home without having to apply or get approval for it. You just work directly with the contractor to get it done.
Well, thank you.
Thank you, Carolyn.
Emily.
Emily.
Carolyn's my mom.
Yeah, I knew that as soon as I said it.
All right. Administration reports, Dave Wyndham.
Okay, I'm gonna share my screen. And go to my favorite subject, which is finance. Okay, and it is up there, all right, so. All right. Okay, so, finances, we're halfway through the year, and I usually do an update for the board about this time, because we're also building our budgets for this coming year. So we'll kind of jump into this. We've changed, our cash flow, the way it comes into us has changed. So we used to get a bump of money at the first of the year from the Department of Health, 100,000, 150,000, first part of the year. That has changed. They are only doing one payment, and it's hopefully in the July contract. Well, last year the contract didn't come till September. So this year we worked hard with our group, Washington Group, which is WASALFA, Washington State Association of Local Public Health Officials, and worked in May to get the contracts done so the contracts can be written in June so we can get them signed in July. And our money arrived just a couple weeks ago. So you see the bottom open-ended line. Well, that's going to jump up in July, back up. It's not going to jump up as far. So in the past, we were getting about $2.2 million. We're getting about 1.4, actually a little less than 1.4. So we've had a substantial drop in our FPHS funding, and that's the Foundational Public Health Services funding, and that's a tongue twister. What FPHS is, years ago, we sat down and said, look at all the things that public health can do. What are the things we have to do, and let's fund that. We call that foundational. So we cut this huge thing down to a smaller subset. And then over the next 9 years, we went to the legislature and got a little more funding, a little more funding, a little more funding. And then this year, the legislature cut us back, so less funding. And it's just kind of the way it goes. That piece relies on what the legislature will approve for us. And we don't have a fund source connected to FPHS yet. We're trying to work with the legislature. Give us a funding source that we can count on, and then we can manage it. Hasn't happened yet. So,
Hey, David, question, that
yeah.
big decline was a lot of COVID dollars that were there that aren't now. Is that correct in that budget?
With
2.1 million down to?
No, that was no COVID
Okay,
money.
there you go,
That's I'm just setting COVID
Fair
out
enough.
of the picture
Okay.
here because COVID was a completely separate thing.
Okay.
COVID was never in our budget, so, although it did show up in the spending. Okay, so county contributions, county has been basically level the last few years. In 2021, this is where COVID comes in. We spent COVID dollars instead of county contributions in 2021. So we had the money to do that. We are still flat at $376,255, which we've been at for a number of years. So county contributions have not increased. Fund balance, and this is where the problem with DOH shows up is in the fund balance. Our fund balance looks low because at the first year we're not getting our first bump of money. So, and that's going to probably be the trend going forward. So we'll be low, because fees, permits, those things don't get us up to zero until we get our other money. And then we spend that down after July, and that's going to last us until the next July. So the trends look different than they have looked in the past, just because the way the funding from DOH and soon the feds has changed. So when people look at our finances, they go, "Oh, you're so low," but we are, but it's coming. We have to realize that it's not, the world is not ending. Revenue by source. And I'm going through this really fast, so if you have questions, I'll put on the brakes. Federal dollars about 29%, and state funding 43%, and that includes FPHS. It includes other contracts that we may have with the state for, say, WIC and other programs along those lines. So we have almost none of us in public health have a single source funding that funds our position. We have to blend funding for everybody in order to keep staff. So in that reduction from 2.2 million to 1.4, we've taken 5 staff reductions, and we had one we were going to hire a nurse practitioner, and we did not hire the nurse practitioner. So we've had to find other ways to solve those things, getting the services out to the community. So for example, we're partnering with North Mason Fire to provide an ARNP to do services, and then we're funding that out of the opioid treatment. So we're we're moving money to try to accomplish the same mission as best we can. So,
So I have one request.
yeah.
Can you switch to a slideshow? You will
Yeah,
increase
if
the
I can-
size
yeah,
about 25%.
if I can- Yes, there we go, okay. There we
It's a
go,
little better.
a little better. Oh, it looks so much worse. No, you can see it. So, fees and permits, 10%, 9%, so just figure 10% each on those fees and permits, and that's out of the environmental health. County contribution, 7%, transfers from mental health is about 2%. The books will show us having a big opioid balance, but that opioid balance doesn't belong to us, it belongs to the commissioners. We're just the placeholders for that. It comes to me and it goes to the county. So I do all the applications and manage the money, and it just goes over to the county. And then the commissioners decide where that's spent, given the guidelines of what the opioid plan involves. So, okay, any questions on revenue? Revenue is changing. We do get some grants out there, you know, through different organizations, but pretty small. I mean, we have some contracts with DOH now that are down to $500 for a contract, you know. So some of it gets very, very small. Okay, revenue by source, Clean Water District, federal dollars, gives you some numbers there. State funding, $325,000, so that's our other dollars. Permits, fees, county contribution, transfer. Now, county contribution is showing it as 0. So the reason it shows it 0 now is because Casey and I usually wait until towards the end of the year, and we draw the county funds in, because at the end of the year, we have to pay our county overhead. So we have 7% that we pull from the county, and then we pay 7% to the county for our overhead. So it kind of comes in and goes back out again. Okay, expenses by sector, internal charges, you see there 7%. Salaries and wages, by far our largest piece. Benefits, the next largest piece. And then you look at what goes into supplies and services, that's really only about 22% of our budget actually goes out the door in services. I mean, it does go out the door with salaries and wages. So I need to put a caveat on that. It's not, there are other things we pay for in that 20%. You know, we'll do contracts with subcontractors to provide services. So, and this is where we're at right now. So we have budgeted in the blue and what we've spent so far in expense. So we're doing pretty good. We're on track. Nothing shocking, nothing that keeps me up too late at night. So that's the end of the slideshow. In preview of coming attractions, in the spring, the state changed the way they authorize REAP dollars. I'm gonna stop my share. REAP dollars. There are now 3 avenues where public health can access REAP dollars. So that's the real estate excise tax. So we're looking at, I'm presenting to the commission how those can be used, and then we'll talk with the commission on what they're comfortable with doing going forward, because some of it is councilmatic action, some of it would require a vote. So it's complicated, and I've got an informational piece that's coming up very shortly.
When you say a vote, do you mean a community vote or a commissioner vote?
Yeah, community vote. Councilmatic is just the council takes action, otherwise it needs a community vote.
Which requires a vote.
Yeah, right, which requires a vote of the commissioners.
Yeah.
Right. On the horizon, HR 1, the big beautiful bill, and we're gonna lose about 20% of the Medicaid slots, is what we're projecting. And so it's gonna look like public health looked in 2012. So I expect a lot of the services that providers were doing for Medicaid, they're gonna want to transition to public health to provide those services. So in 2012, we did a lot with STDs, family planning, a lot of direct clinical services for little or no charge. And we had to bill insurance, we had to do Medicaid. So I see that probably coming back to us in the next year, depending on how things shake out with the Medicaid population. So we'll see what happens. And all the public health departments are seeing the same thing and wondering, what's this fall going to look like when HR 1 hits in September. So we will see. We may have to go into books of business that we haven't done for many years. We'll see. We'll see what happens, and this board is going to help decide those services that we are going to continue to provide. I'll come in with the budget estimates, cost estimates, and then we'll decide which of those things we'll do and which of those things we won't do. So we have increased capacity in the last couple of years. We have a mobile van now. We have with the 2 clinic rooms and the mobile van, and then we have at our other building 2 clinic rooms there. So we can do things in-house. How we've cracked some of this so far is by partnering with people like North Mason Fire. And we provide the van, we provide a driver, they provide the AR&P, we get the supplies. Between the 2 agencies, we get things done. And same thing with the hospital. The hospital's been great to work with. For example, WIC. The hospital provided out the money to seed WIC and get the exam rooms done. YMCA gave us the location. We provide the service. So we couldn't do it by ourselves and stay in the black, but if we work with other agencies, we can do that. So that's kind of the creative financing we've been going through. So on the horizon, I don't see any more money coming from the state. The state is billions of dollars behind. So we'll see what happens there. DOH just laid off 200 people. And they're in the process of bumping, so you never know who you're going to talk to next. You'll call an office and get a completely different person that you talked to the previous week. So that should settle out in the next short while, I hope. So we're back into kind of a 2012, 2017 mode for public health, where resources are drying up, and we'll have to look at new ways of doing things, or just cutting them off. So. So far, we haven't had to do much reduction of service with the people who retired, and we just haven't refilled those positions, and that's saved cash there. So that's that for finance. We did have a big meeting last week with all the directors and health officers, with the Secretary of Health, DSHS, Healthcare Authority, and Ecology, and got to ask them questions. I asked a couple hardball questions around, water resource allocation, and then some other things around the Rural Health Transformation Plan grants that DOH has had for 7 months, and then they came out with a request for proposals in July. You have 1 month to reply. And unless you have staff that's dedicated to jump on funding opportunities like that, you just miss out. And it's not public health by itself, it's the health clinics, the FQHCs, the small hospitals, all those places, especially the more rural you get, the harder it is to access those funds. So I did have some words with Healthcare Authority and DOH, and it was funny, afterwards they came and said, well, we would like you to sit on a panel with us and help us figure out how to do this. So I said, absolutely, I'll do that. So try to keep money coming to the rural areas and keep our services going. So that's all I have.
All right, questions for Dave? Comments for Dave? All right. We're now, Dr. Steve Krager has a health report for us. Dr. Krager.
Can you hear me okay?
Yes.
I think I should have some slides if we're able to get those up. So yeah, I'm Krager. I'm the health for Mason County. I don't see slides. Is it just me, or am I missing something?
We're not seeing them here.
Yeah, let me see if I can share. Sorry about that. Okay, almost have them up. All right. Let's see. Hope you can see my screen now. Sorry about the delay. Perfect. Okay. So, you may have heard in the news about something called cyclosporiasis. I'm just going to call it cyclospora because it's a little bit easier to say. Unfortunately, it's been causing a rather large outbreak, foodborne illness outbreak across the country. Good news at first. We haven't seen any significant number of cases in Washington tied to these larger outbreaks. So I want to get that out of the way. But we do see cyclospora kind of across Washington, usually in the summer months, often associated with travel, usually to somewhere international. But we've been seeing a ton of cases kind of focused in the Midwest, but it's been other parts of the country as well. So what is cyclosporiasis? It is microscopic parasites, so a little bit different than a virus or bacteria that often cause foodborne illness. Can cause some pretty nasty symptoms, frequent watery diarrhea, cramps, bloating, nausea. Less likely to have vomiting, so that's something that makes it a little bit different than some other foodborne illnesses. Can last for days to weeks, unfortunately. Other foodborne illnesses will often resolve on their own. Cyclospora often needs treatment, which we do have good treatment for it. It's very effective, and one of the messages we want people to think about is if you're having symptoms like this, it's worth asking a provider, a doctor, to get tested. From a public health standpoint, we want to know too. We want people to get tested, and it helps us maybe do some contact tracing. Just to give you an idea, this is kind of our general curve of, this is across the country, so our general curve of cyclospora cases, we start seeing more July, August, and we just had a much steeper curve this year across the country, and this is actually very, very small, right? This is an older graph when the outbreak was kind of first going on, and I think we're over 16,000 now, so just much, much more than we usually see across the country. You've probably heard that some food was recalled, and that's true. An iceberg lettuce recall happened with Taylor Farms in Mexico. I will say, just as a caution, we don't know every source of every outbreak. There's more than one outbreak happening. This was the largest outbreak tied to iceberg lettuce. It was associated with Taco Bell, but it was also associated with a lot of other bagged lettuces, iceberg lettuce products. Thankfully, we haven't had any cases in Washington tied to any of these larger outbreaks. We do see cyclospora cases in Washington. I think there's been 60 this year. The vast majority of those have been international travel related. So someone went somewhere for travel, came back, had symptoms, and was tested positive. Obviously, that could change at any time if we, have some contaminated food that makes its way into our food system. We could certainly see cases, but I do think it's important right now we're not seeing that. And it makes it a little bit difficult from just a communications perspective about how to talk about risk. And as a physician, I want people to eat a healthy diet that includes fruits and vegetables. So it's without a clear source in Washington or a clear food that maybe we shouldn't be eating, I haven't been recommending that people change their diet. I would recommend people do your basic food safety practices. But right now, again, we don't have a specific source to avoid. and I want people to have a wide, varied, healthy diet. Obviously, if that changes, our guidance would change, but that's my guidance right now. Let's see. I think that was end of my slides, but just in the last day or so, we've seen smoke. I think we are seeing some smoke impacts across kind of western Washington, associated with fires in eastern Washington and Oregon, as the winds kind of shift. And just a reminder about watching those AQI numbers, being cautious about especially vulnerable people, but even anyone, especially when it gets over 150, thinking about minimizing our exposure to that outside and staying indoors if possible. That's my report for today.
Questions for Dr. Kroeger? Do we have any information on the shellfish poisoning and where we are with that?
In the canal you're talking about?
Yes.
I would ask, I haven't looked at that in a little bit, so I would see if Ian has anything else to add.
Yeah.
Sorry, Ian.
The closure is still in place for recreational. Several of the areas have started to reopen for commercial. Once the entire canal is cleared, then they're going to start reopening the recreational areas. But there's still several areas that are closed still. But Annis Bay recently reopened, Hood 9 reopened, I think Hood 8 reopened. It's still patchy.
It's a little confusing to the general public when we have commercial open and recreational open. I think there should be some sort of messaging. I don't know, Facebook, or just get it out there. But I see a lot of comments where this theme's coming up. We're taking care of the business side, but the recreational person's left out. And so I understand the testing and they do more frequent testing, but that's a concern that I've been seeing out in the community.
I have a question, Dr. Kroeger. So is it required if you do get the foodborne illness from the lettuce, whatever you're calling it, is it required to get treatment to get better, or can you kind of wait it out?
That's a great question. I think some people are able to clear it on their own. It depends a little bit on your immune system, but it's gonna last longer than your typical foodborne illness. So even healthy people it can sometimes be weeks of persistence. But I do think there are some people who are able to clear it on their own. But again, treatment usually makes the most sense for people. Yeah, I wouldn't, depending on the severity of symptoms, what gets people into trouble is dehydration, right? So that if you're not able to kind of hydrate yourself enough compared to what you're losing, that can be dangerous and have you you could end up in the hospital. So that's kind of our main medical concern.
All right, any other questions? Thank you. All right, environmental health report, Ian.
I'm happy to do my report. I just wanted to bring up that Melissa's item I think is very short and mine is very long. I didn't know if you wanted to revert and have.
All right, I don't have a problem with that.
Thank you. I'll be quick, I promise. Good afternoon. You have my report. I just wanted to highlight a few things, especially some things that didn't make it into the report. WIC's caseload as of last week has actually exceeded 1,000. And that is very huge because we don't even have 2 full-time employees who work for WIC. And so it's a huge kudos. Rachel Hook, our coordinator, has just provided such an exceptional level of customer service to the point that there are even clients who drive here from Tenino and other counties because they're so pleased with the services they get here. So that is a very big one. As you can see from the report, we've just been very busy this summer. And again, I just have to give kudos to our team. A lot of this has been done just through the community partnerships that we do have and the relationships that staff have maintained with those in the community. As you can see from our Bike Rodeo and Safety Day, we reached over 200 kids. That doesn't include the families and the older children that did join them. And it was because of the partnerships that we have with 40 community partners that we were able to pull that off. You learned from Dave's report that funding has been not a very fun conversation. I think for this event, the public health contribution was about $70 just to rent the school parking lot at Olympic Middle School. Everything else was done, again, from the relationships that Rebecca Shipman, our public health nurse, is really the person who brought this idea to public health. The relationships that she has with the fire districts and other kind of safety-related organizations is why we were able to pull that off. So, very exciting. I think we're going to continue to see that. We were able to distribute bicycle helmets, life jackets, and do a lot of safety education with all of the people that attended. We also had boat whistles too, and firearm lock boxes. Thank you, Dr. Finn, for sharing what the visible impact has been of the syringe exchange program. We have been working so hard to evaluate our mobile outreach program. Dave mentioned that we have our new mobile unit. Back in June, Christina Mullershin, who was our longtime community health specialist, who really spearheaded bringing that program to Mason County, she did leave us back in June, but we have since rehired that position. Her name is Michelle Stacy. She's actually a licensed mental health professional, and she's also worked with other organizations. She helped start the jail reentry program that we have in the Mason County Jail. And with her being on board and with other staff, we've really spent, again, a long time, worked really hard with evaluating our policies and procedures because of the background that she has. We're really looking at the whole person health. So spending a lot more time with participants rather than it just being come to our mobile unit to get the things that you need. It's really spending time with what are the other health-related needs that they have. Do they need help finding stable housing? Are they ready for treatment? That is really our biggest goal right now, is to really establish that. We're working on what our performance metrics are going to be so that we can actually share how successful that is at some point. And as Dave mentioned earlier, really emphasizing the use of that mobile unit as a mobile unit. Our partnership with North Mason Regional Fire Authority's Mobile Integrated Health Team has really been how we've been able to get clinical services out. So they do infectious disease testing, wound care. I also have some meetings upcoming with Public Hospital District 1 to, again, see how we can get a provider on that unit and get it out on the road 5 days a week. I think that's all I really wanted to highlight. If there are any questions about the reports.
Any questions?
I just want to say congratulations on your farmers market nutrition program, your customer service, 92%. The participants rate is excellent, so very well.
I'll pass it on to staff.
Thank you. With Ian's admission that we have a long briefing with him, does anybody want a 5-minute break?
I do.
Okay, so 5 minutes. Okay.
Thank you.
Just thinking, he said long.
Excuse me, this is my
Yes.
first time at the Board of Health meeting. I did not get any of these packets that you guys are talking about.
All right, we're back, and Ian Tracy.
All right, good morning, board members. Ian Tracy, Environmental Health Manager. The first item I have is a Board of Health report. Not a whole lot going on, but we did have our first ever, to my knowledge, criminal search warrant that we executed with the Sheriff's Department for a solid waste case. Our staff spent 9 hours, 4 staff spent 9 hours cataloging over 70 vehicles. Some of them were not accessible, and the Sheriff's Department had 4 sheriffs there the whole time providing security for the event. For context with what that means, we are a civil arm when it comes to code enforcement. We don't do criminal code enforcement. Once things pass into the criminal realm, the health department is more of a subject matter expert for the Sheriff's Department. The Sheriff's Department takes the report that we generate from the search warrant and will then do a criminal referral to the prosecutor's office to see if the prosecutor's office will accept and take forward a criminal case. That's how that process flows. And we would be summoned to court to testify about what we observed and the information we documented. That's the role we would take there. But we're not the leads for criminal cases.
What day was that? When was that done?
27th, or, yeah, because you were on the team.
In July.
Yes.
In what region of Mason County was that in?
I guess it would be eastern Mason County.
Got it.
And then, any other questions about that item? Okay. Then the next thing is we've hired a new staff member, Daniel Osborne. It's a project limited position, so he's hired to work several water quality grants we have right now, in both Sound and Hood Canal. So we're happy to have him aboard. Were there any questions about our staff? Any other questions?
Nope.
Nope? Okay. So with that, we'll move on to the next item. The next item is the on-site sewage advisory committee. We have two applicants. One is Paula Johnson. Well, first of all, for those who don't know, the on-site sewage advisory committee is a committee that was established by the Board of Health to provide recommendations to the Board of Health on policies, procedures, and code updates for the on-site sewage code. And it's a panel that's made up of several industry positions as well as several citizen positions. There's also a shellfish representative position for the shellfish industry. So it's a pretty lively board. We meet in the evenings on, I think it's the first Tuesday of every month. Or sorry, every third month. So it's a quarterly meeting. And Paula Johnson has been on the committee for quite a while, and she has applied to extend her term for another 3-year term. And then Dale Taja has also applied for a vacant designer position. So these are not competing, just so you know, these are not competing applications. We have a vacant designer position, which is a position that Paula currently holds. Dale Taja has applied to fill the vacant designer position, and he's a licensed designer, and he's also been on the committee in the past, and he's applying to rejoin the committee. And he is a former employee of Mason County Environmental Health. So I don't know if the board would like to interview Dale or wants to appoint him.
What would the staff's recommendation be?
He's generally, in good standing with us, so.
And it looked like from his, that he was well qualified.
Mhm. Yeah, and the board obviously, previously appointed him.
I would say we can dispense with the interviews.
All right, is there a motion?
I move we appoint both, and I
Paula Johnson and Dale Taja.
those two.
I'll second that.
All right, discussion. All right, there is a motion and a second to approve the appointments from staff to the on-site sewage advisory committee. All in favor, say aye.
Aye.
Opposed? Motion carries.
All right, next item is the proposal to amend Mason County Code 6.04, general definitions and general provisions. This is an item that was on the previous meeting in May, and at that time, the board had decided to postpone the discussion of this item for the next meeting until Commissioner Trask could be here. Commissioner Trask is not here. So if there's no objections, I'll continue.
On the discussion on that one, we've had some community input here and some recommendation of changes.
Yeah, I have a whole presentation, well, I have a whole discussion.
Concern, yeah.
Including perhaps the changes and differences.
I read through it and looked up all the RCWs, and they don't match what's listed here from my reading and research also. So I would suggest we have some changes to make still.
Okay. Well, as far as this code goes, to give everyone context, this is a regulation that was established back in 1970. I suspect that it was probably the only public health regulation that existed. Since then, our regulations have changed drastically. Environmental health does not use Mason County Code 6.04 at all, has zero utilization. If there's anything that gets used, it might be the definition of person. That's about it. The changes were, I was instructed to make these changes because there are major conflicts with Fourth Amendment violations. Particularly, it gives us powers that we don't have, which is to go on properties at any time we want, regardless of owner permission. And then it additionally criminalizes the resistance to our entry onto the property. So there's major challenges with this regulation. Those challenges are so significant that I was instructed to just forego doing a deep dive on the regulation, because the question exists, do we need this regulation at all? Is there a purpose that it serves? I don't see one that it serves. The authorities that are in this regulation are essentially all from the RCWs, and we don't need to adopt RCWs to use RCWs in Mason County.
Whose guidance was that? You said someone gave you some guidance, or you
Well,
said-
these are instructions that are a combination of guidance. One is my boss.
Yeah.
He told me I needed to do this. I believe Travis was involved in that decision, and our attorney, Tim Whitehead, instructed us to do this. That was a major issue. I can't emphasize how major of a liability issue this regulation
This was
is.
a fragment of code brought over, I think, from, what was, Thurston Mason Public Health. Tell you how long ago that was.
Yes, we were, when this was created, we were a health district of 2 counties.
Yeah.
It's a completely obsolete regulation. And I'm gonna share my screen with the boards, just to give everyone some context on what we're talking about when we do code enforcement for solid waste and on-site sewage. So, first of all, this is the Mason County Code, and Title VI generally is the sanitary code. So, this is what public health mostly uses. And within the sanitary code is the general provisions and definitions section. However, you'll look through this and you'll see that there are a lot of things that don't apply to us at all. There's weed control districts, that is not a public health function. There's public docks, specifically the Hoodsport dock. There's sludge utilization and disposal. Mason County can't authorize sludge utilization and disposal. That's an ecology thing. There's the hazard communication program, which is an internal policy for the county on how the departments are going to document hazardous materials that they have on hand and how they're going to communicate those hazards and make sure that there aren't any employee injuries or injuries to the public from being on our facilities. So it's really a grab bag of things, but the majority of what we use in here is the on-site sewage regulations and the solid waste regulations when it comes to code enforcement. So that's where everything starts. If there's a solid waste violation or an on-site sewage violation, we go to the appropriate code, we find the language that says this is a violation and you can't do this. Then when we decide that we have to take additional code enforcement action, back in 2017, Mason County restructured their regulations and enforcement, probably because the enforcement provisions that were within Title VI were fairly weak, and they enhanced them. And that is where we come to Title 15 Development Code. So the Development Code has a section called Enforcement, and I believe it's in the introduction section. In the purpose and applicability section, they essentially adopt the Title VI regulations into Title 15, saying that Title 15 can enforce Title VI regulations. which means that we use the Title 15 enforcement section. So Title 15 enforcement gives us all of our penalties. It makes issues that are not corrected, criminal violations. It allows us to go to the hearing examiner. It allows us to issue infractions, which is this section. So infractions are under an RCW.
And
They're Class C
I
civil
need to
infractions.
clarify, is it can or shall
Which is,
use this?
we can use it.
Can, not shall, okay.
Yeah,
And
we
that's
don't have
important.
to, we don't have to use this, we can use it. And 99% of the time we do use this because these are the most effective enforcement tools we have. The penalties that are in Title VI are very weak. And a lot of the penalties in Title VI are administrative fines and don't allow us to go to court for them. And there's no hearing examiner pathway. There's no way to get somebody in front of a person to get due process for an issue and move something forward. Due process is very important in code enforcement. You can't charge somebody with something and just say, and you're guilty, and we're taking your house away, or wherever. There has to be a due process step where they can have a hearing before somebody, whether it's a judge or a hearing examiner.
Why aren't we just removing 6.04 then?
So 6.04 is there, our regulations have so many issues, many issues all throughout all of Mason County's codes. And 6.04 is something I found when I started in the manager position. I said, this is not good. This is something that needs to be updated, but there are much higher priority things to update. So I did a partial review. I partially made some changes to that. I had a draft that was in progress, and when I was told that no, we can't wait on this, we have to knock some of these things out that are major violations of the Fourth Amendment and Washington State Constitution. I moved forward with the changes that I had because those RCWs that are referenced are really wrong, and many of them don't exist anymore.
This is kind of just the beginning, and we're gonna keep working on this.
This is
Yeah.
a stopgap to take care of major liability issues until we can do a thorough review of it and say, do we even need it? I don't know if Melissa or Dave would need this regulation to deal with someone who's not maintaining quarantine for TB, or someone who is.
Yeah, see, and that's addressed now in RCW, so.
Yeah, at the out of the the surface of it, maybe, I don't know. I just know that the issues that have been caused with enforcement and liability have been specifically related to environmental health, and that's what we need. That's the door we need to close, or the.
And there may be a time in the future where we use this as teeth to do something else.
You'd probably be better off changing some of the more applicable regulations, though. This general section is not super helpful, but you're right, we could make 6.04 the enforcement section for all environmental health regulations and come up with some other solution. That is a possible pathway. But at the moment, I'm simply trying to protect us from liability. And as far as RCWs that are references that are wrong, you had mentioned that you felt that there was one that was wrong.
Yeah.
Can you tell me which one? So 120 you feel is wrong because,
If you look at it, it's dealing with healthcare and
So-
worker, not
yeah,
violations.
and that's the intention. So if you read 4 has the quote that has been deleted, that was mentioned on, let's see, I'll go to the page. Okay, so, in Dr. Finn's letter, he picked out 6.04.050, where it was changed from 070 to 120.
Yes.
And that this quote was removed. So that quote is still in existence in sub 4, because when the RCW changed, they completely restructured everything, they got rid of 070, and they put that information in 120, and then they expanded on it to have penalties for healthcare workers and healthcare facilities, as well as boards of health and health officers. And number 4 is where it talks about, that's where it gets into people and people violations. So in the RCW, that is the section that is used. There is no other section that's applicable or equivalent. This is the replacement section.
The .1, that one has been recoded to a different number. It's not even listed anymore. That was
RCW's
04.120, I think it was.
70.05.120.
It's 604.100 permits. C.
So we're 604.120 is oh, you're talking about the previous version or the current version?
What you have written in here.
And where does 6.17?
It's been renamed to that.
This
one you have highlighted, I could not find.
That's Mason County Code, that's not an RCW.
Okay,
Yeah, that's what's going on
that's the
there.
difference, okay. Thank you. Those are my main things that I saw.
Okay. You'd had a question this morning, or no, I think you said it yesterday. I had talked with Tim Whitehead again this morning about the recommended changes, and he did a second review just to try to allay your concerns, and he said that these are the changes that need to happen. They're fully approved by him as our legal counsel, but that he was not able to be here today. It's just too short a notice for him.
So you and David have been working on this independently and then getting advisement from the attorney. I think that's just a lot of work for you.
It is.
With you know, enforcement actions and all that, and I'm just, you need to get you some help.
It's all on me.
It's a lot, you're not an attorney either.
No, absolutely not. So that's the purpose, that's the intentions. If this chapter disappeared overnight, it wouldn't affect environmental health in any way, shape, or form, except in that slight chance maybe with the definition of person. That's the only thing that I can think of that in some rare circumstance, if we had someone fighting us on what the code meant and whether they were responsible for something, that expanded definition of a person may be helpful in some circumstances. It's by no means a perfect regulation, and like I said, this is by no means an attempt to make 6.04 perfect. It's completely useless from the standpoint that everything that it references is wrong and old and outdated, and goes back to when we were a 2-county health district, and then has the major liability issues. When you have a policy that tells a staff member that they need to get permission to go on the property to do something, or let's say it's an instruction to a staff member, we say you need to get permission before you go on the person's property. And then, let's say the person tells them, get off my property, they leave, and then they come back and go on that person's property. And then we say, why did you do that? You're not supposed to do that. They point to this regulation, they say, I have the authority to do that. I have the authority to go on that person's property, even though they told me I couldn't be there. And I can have them criminally charged for obstructing me. So it's a major issue, a major liability issue for the county.
Is there any history that we've held someone criminally liable for that?
No, not that I know of.
as somebody from the RISPO, the real issue comes with them going back on the property after being told to get off the property. This is justification, but no matter what law we put together, now, there's some things I want to change here, but no matter what law you put together, you're not able to put together a law that takes away their right. It's just not possible. But yet an employee may feel as though it is because they have a code that says so, so.
Yeah, when they're told to enforce the code, it's definitely a major issue.
I guess, Dave, my question is, do we consider passing this in a flawed version, or do we consider revoking it and
Not even
reinstating
having
it when you've done your other investigations with the other departments?
So,
What would you
I want to back up a little bit. So the way I have done it in other health districts that I work at is basically in the wintertime, we revise code. We took that January, February, slower time, and we revised code every year. We just kept after it. And we come back to the Board of Health in the spring to clean up, because things happen with the legislature, things happen otherwise. So I would say pass what we've got here, and we come back again. It's just gonna take multiple scrubs at this to get it, I think where we need it to be.
Have you considered looking at what other counties are doing? Easier to not recreate the wheel here, you know what I mean? Find out what they're doing.
Yeah.
And take the pieces that pertain to us.
Some of them do it as simple as see the RCWs,
Right.
With no extra fluff at all.
So I can speak on that a little bit. When I rewrite regulations for the county, I am always checking with our neighbors to see what they are doing, how they've written their code, because it makes it a lot easier to come up with something that has already had a trial by fire in another jurisdiction. In this case, this is a legacy issue. That's a problem. It's been a problem since the 1970s. It was a problem from the day it was passed in 1970. So I'm just trying to get rid of that problem until I have time one day to do something else. I mean, like I said, our regulations don't need this section. This section doesn't provide any benefit to us. For me to do a deep dive on it and make it into something that it's not right now would be, it's not needed, it's not necessary at the moment. All of the legal tools that we have available are there right now. Our biggest challenge is funding when it comes to having the money to use all of those tools to their greatest expense. It's very costly. You can imagine with the search warrant that we just did, having 4 of my staff members for 9 hours doing that inspection and 4 sheriff's deputies on site that entire time. That was an expensive day, and that's just one step in the process to establish evidence for a case. That doesn't include all of the years that have gone into interacting with that property and with that person, trying to get them to come into voluntary compliance. It doesn't include all the hearing examiner hearings that have already happened. It doesn't include all of the previous civil court hearings that have happened with that person. So there's a lot of time and money that goes into code enforcement, and there's simply nothing in this section that gives us a benefit other than an ability to violate the Fourth Amendment that is not legal.
So maybe we don't need this code at all.
Well, and that's why I said my only hesitance is I haven't been able to do a deep dive on whether this is needed for some reason. At a brief glance, I don't like to make snap decisions. At a brief glance, I don't see anything in here useful except for the person definition. I don't know, like I said before, if Dave or Melissa might have a situation that arises and they say, aha, this is where I need to use this because we're dealing with a person with a communicable disease that is not, controlling it or is not following our instructions.
So now, I myself, I'd like to see it stay until we do the actual work that it takes to find out what it is and what we can use it for. Because right now, although what you're saying may be correct for what you think, I don't agree with you on some of it. There are things that we still need in order to enforce. And this may be the vehicle in the future that we may be able to use to do it. One of the things that's important, though, is that we do not violate the law with the things that are in it, so that has to come out. That's the important part. We can't be saying things that put us in a risky situation where we can be sued because we did, or we had staff that went and followed the code, but we know that the code is outside of the law, so we have to do those changes in order to protect ourselves with it. I also hear the citizens speaking on that, and if I was, to have an input on it, a couple of things that I'd want is like under the section, what do you got here, 040 under enforcement, an addition. Everything that you have in there currently, but add to it, this section does not preclude or restrict staff from exercising other legal options. That takes care of the comment that was made by the citizen, and it doesn't put us in any jeopardy, which is important to me. It just shows that if there are other legal options, they're not limited, there's no limitation to it except for what the legal options are. So I don't see any risk for that, and it seems like a low-hanging fruit in order to help the citizen get to where they want with what we're asking. The second one would be,
I just want, before you move
go
on
ahead.
to that, we can do that. It's gonna have to get reviewed by Tim, of course.
Then, okay.
It's not gonna matter one way or the other, like I said, because we don't use this at all. But I'm totally.
It does to
fine out.
it does to the citizen,
I
and it
get
does
that.
to me, as one commissioner, it does to me.
Yeah.
That's what I'm telling you, it does, because it may be a vehicle for the future, so,
Yeah.
I can see that it does with you, but to me, it does.
I get
That's why I'm
that.
asking
All
for
I'm
that.
saying is, when you look at it at the end of the day, if the language changes, my staff aren't going to be able to go to that and say, oh, I can use this to do this other
It's
thing.
not for your staff, it's for stop us for legal lawsuit, or to say there was a limitation because we only said that. I'm looking at it from the risk pool side of it, to make sure that we have the leverage to do what we need to, and not say there was a restriction because we left this
Well,
thing in
even
place.
without those words, it sounds like we have the wherewithal to go, you don't
We do.
use this for that anyway.
We don't.
So even without the words in this, you have other options.
Yes, we have any legal options.
Yeah.
Because they're legal options.
Even without stating that in here, we know we have other legal options, so I don't
Yes.
know why it needs to be stated.
I will tell you, because again, I'm on the risk pool, and I'll tell you what it is they use that one paragraph to say that was the restriction.
But it's not a restriction.
No, they'll say that you were only entitled to this. That's what they do, that's how it works. And now it's everybody's involved, it's not just the person anymore. You got investment companies that are paying into these things, and even in these small ones, they're actually paying in because they get the rewards off it. Was it BlackRock and stuff like that? That's what's happening in the whole state of Washington right now. So, you wanna have the leniency in the words to allow for what may come, just in case, because other than that, it will be limited to only what it says if somebody decides they're gonna sue us based on it.
But we've been told this is a working document, so we're not done with it yet. So we either gonna scrap it or we're gonna pass it. I mean,
I would
it
like to
sounds like
pass
it
it
needs to be
today.
done,
I-
one way or another.
Ian, where's your comfort level? I understand this kind of rolls up to you. I mean, and this is what you're asked to do. Where are you on a comfort level, giving us your idea or your choice of what to do today? I mean, do you feel comfortable going out there and saying, this is what I need to do, or this is what I want to see it look like based upon my knowledge? Does that make sense, the question?
I mean-
Do you feel comfortable enough in your role? I would love to have an attorney here, I really would. That's what I
Yeah,
feel we're
yeah.
missing here.
Well,
And I feel like you're
yeah.
acting in
Yeah.
that capacity on
This
behalf of
morning, he
him.
told me these changes need to happen, they have to happen. And these
Yeah.
are his approved language, and that's excellent language. Those were his, as close as I can come to quoting him, words.
Can we get that in email, writing, something?
You're free to contact him and get all the reassurance you want from him.
But if we don't pass it today, there's another 2 months before we even look at it.
Actually, next month.
Oh, that's right, but
Yeah.
it's not that, it's a month and a half.
And then this still has to go through the commissioner's process, which is
Yeah.
a month
Takes
and a
us
half, 2
forever.
month process.
So
Takes us forever.
I would like to just pass it today and let it go on.
Make a motion.
I would make a motion, we pass the changes submitted by Ian.
For a second? I'll second it. Discussion, comments, questions?
I got discussion. I appreciate we're going, but that's ridiculous. If we find a product that's not correct to push it forward, just for expediency. That makes no sense at all, especially when you're talking risk. I don't understand that one, so.
Well, I think
would-
it's higher risk
So
to
I
have
would be,
this.
so I would be voting against that, just making that known.
Yeah. I personally think it's a greater risk to not change it, not to start the process.
Can I just mention one thing? This is not the end of this process for this regulation change.
Right.
There's a public hearing in front of the commissioners, and at that time, there can be additional changes made at that commission hearing.
The only comment I would like to make is, you know, we've only had this around for a mere 56 years. So it's kind of a baby in the scheme of things. If it hasn't really been an issue, is there a rush to not?
No, it has been an issue. We have had a direct issue. We've had a major liability issue. I'm not gonna go into details, but it's a major issue. This is extremely important that this is no longer in our regulations, as far as those sections go.
Well, I think right now it can be handled through staff, through the director directing staff not to follow that. Because I have an idea what you're talking about. And again, that's already known and discussed, and you've got control over it. I don't think it's gonna happen again at the moment, but we do need to, sound like a baby for a minute. My apologies, the dog. Sound like a baby for a second. So again, it only makes sense if you're gonna measure twice, cut once. But there's still another piece that I would like to discuss adding into it too, but there's already a motion and a second on the floor. But I'd like to have that discussion as well.
All right.
And one more comment. We are talking about cutting multiple times in this, I mean, taking multiple cuts at this, so.
All right, anybody else? There's a motion and a second to approve the changes by staff for Title VI, Chapter 6.04. All in favor, say aye. Aye.
Aye.
Opposed?
Nay?
Nay.
Motion fails. All right.
So before we move forward, I'd like to talk about this second part. I'd like to discuss having an addition, if it's brought back to us. And that is, listening to the folks again, the citizens where they're talking. I tried to find a way to see if there's ways we can put the two together where it doesn't put us at risk and still gets us where we need to get. From what I understand, we removed the section under 050 because of the risk there of the things that we have, the limitations of no more than $100, or to imprisonment in the county jail not to exceed 90 days, blah, blah, blah.
Right, 050 changed only because the RCW changed. 70.05.070 no longer is just a straight quote of that. That used to be all of 70.05.070. It used to just be that sentence. It was very simple in the RCW. When the RCW was drastically changed over the years, the new applicable section became 120. And so instead of quoting 120, I just ended it there. Because 120 has all those parts that are in this copy that Dr. Finn provided with everyone. And there's a small piece in sub 4, in paragraph 4, that is that language still.
Okay, and somewhere in there you can add then, just that the limitations are in defining misdemeanor under 9A.20.021. So those are the parameters, so that we don't think there's anything outside of that parameter that's allowed. I don't know if I want to put it there, but just make sure that that's included in there under the parameters of misdemeanor. And the other thing that I wanted to do before we do anything else is I just wanted to verify something.
I'm confused. What do you want me to do?
Well, on that one there in the old verbiage, I would have struck the whole last part and just added to the limitation governing misdemeanors. Because every type of thing could be held up to a misdemeanor, and in the code, it may become a misdemeanor issue in the future.
I think it's still a misdemeanor.
And that's why I'm saying, by quoting the actual code, the actual RCW 9A.20.021, saying that it's governed by the definition of, for penalties on misdemeanor. So that we don't say that you're gonna go to jail for a year, you can only go up to 90 days, you can only get a fine up to $1,000. That's what the code says for, that's what the RCW says for misdemeanor.
So you're saying you want to have, you want it to mention that it just follows the definition of misdemeanor?
Yes, and limitations under the definition of not, the
Since,
code.
since we had a motion and it failed, is this really proper to be doing this now?
Yes.
This should come back to us.
No,
Shouldn't it?
no, why would it,
Well,
we're still.
we made
we're
a
still-
motion and it failed and it's a dead subject. So
No.
now we're bringing a new subject online.
No, it's a motion that
As
failed.
originally
to pass.
submitted is dead.
Yeah,
Now we're talking about
we're,
how
we're
to
still
change it.
considering.
Second part.
Yeah, so now the other part that I just wanted to verify, on 120, you took that out because it's redundant, is all right?
No, 120 just got moved
To 130?
to 130
That's
because
okay.
that's how,
That's why I see.
that's how most of our other Title VI regulations are
And it works
structured.
exceptionally well, we're gonna find that out today. The idea of coming before the board and stuff like that, it's important that that stays in there, so when you remove 120, but you have it down to 130.
Yeah,
I'm
it's still
comfortable-
there.
I'm comfortable with that.
Okay. Okay. So,
My question is whether or not we even need this code at all. That's, seems so redundant.
so what is the board asking me to do here?
Well, the attorney should answer that question.
Yeah,
Be able to answer that question.
so
right?
maybe you can ask Mr. Whitehead whether or not this is even a needed code because.
He's not gonna give that kind of opinion.
Oh.
I've talked to Tim about those types of issues before. What Tim says is that if we need it, then we need it. If we don't need it, then we can get rid of it.
I think we should get rid of it.
And then when we have a proposal, he reviews it and says, yes, this is legal, yes, no, this is not legal, or you might get yourself in trouble by doing X. And it gets, fine tuned that way.
Randy, you had some language earlier that you wanted to add in to
Yeah.
address the concerns of the community.
Yeah,
Is
and
that the one change that you're?
Well, that and the other one by adding the part about the misdemeanor, because they're worried about that being taken out. We can do it by referring to the actual code itself, the RCW, and the parameters of which that is in there. By just having that in there, inherently, it's part of it. So we don't have to do something so strict that it's putting it into place, but we don't have to remove it completely, is why I was just thinking of literally just referring to it in the code within the parameters, and that shows that our thought when we were putting it into place was considering that, so therefore intent in any type of legal issue becomes part of the defense. But the other one was the simple one, and that was the referring, that it doesn't preclude, so it just allows us the leniency to be able to keep moving forward, that it doesn't preclude us from following other codes and laws. The way I actually wrote it out was, this section does not preclude or restrict staff from exercising other legal options. By doing that, it covers what he's saying again, but it also covers us as a county to say that we have other options, so they can't hold us to that strict code. If something does happen in the future as well, this may not go away for a while, and if it does, it may be changing to something else, we don't know. I myself, I would be willing to move forward and vote for it with just those two changes. The idea of just leaving that out just seems like a weakness.
Is Counselor White, does he participate more in these? And I mean, no disrespect to him, but he just doesn't.
I don't know if I've ever.
That's a problem. I believe.
Just so you know, we as commissioners, we have control over budget. We do not have control over other elected positions and their staff and how their time is spent.
And even if we pass something here today, it has to go to the commissioners
Yes.
Right.
anyway.
So it has to go to Tim again for legal review
Yes.
before it even goes to the commissioners again.
Yeah.
So if we were to pass it with this, with the
It still gets
additions I
another
mentioned,
legal
I
review.
would be able, I'd be willing to vote for that. It would still go to the attorney before we come to us with his recommendation.
Would you all make a motion with the changes?
I can.
Okay.
But I wanted to fill the room out and just see how they thought, because I don't want to jump out
I
front or
think
anything.
that we need to move forward somehow.
So I'll go ahead and move that we move forward with the recommendations by staff with addition under, what was it, 0.40, to add that this section does not preclude or restrict staff from exercising other legal options.
Second.
All right.
Well, one more thing, addition, the other addition is a memorandum addition of the restrictions of a misdemeanor under 9.0. I have it written down there for you. No, I don't know what to do with it. I'll get it for you.
Of county code?
Yeah, it was 9.4, 9A. What did I do with it? I didn't go anywhere.
Was it 050, the penalty section? Is that what you're talking about, where you wanted the?
I was actually defining the misdemeanor by law so that it can't be used for something else. It was only defining the misdemeanor.
Are you talking about in the definitions?
Yes, of the RCW, let me just. How did I lose that? 9A dot 20.021. That's where it breaks down that it is punishable up to 90 days in jail, a fine up to $1,000 or both.
Did you say 9A.20.201?
9A.20.021.
Thank you.
RCW. So I'll make that motion with those two changes.
One
Sure.
clarifying question. So do you want me to reference RCW
Yes.
9A? Okay.
Yeah, and restricted by the definition of misdemeanor.
Okay.
Sharon, your second, so good?
Yes.
Ian, will you confirm what Randy said so we can make sure you got it all?
Yes. The first thing I have is under 040, we would add the sentence, does not preclude or restrict staff from exercising other legal options. And then the RCW, I believe, Commissioner Nolan, you're saying that under 050, where it mentions penalties, we would add in a statement that we would follow the definition of misdemeanor in RCW 9A.
We could even say up to a misdemeanor defined as 9A by RCW 9A. That protects the county too, so that we're saying that that is the limitation. But it also takes care of the request from the citizen at the same time if possible.
Would it be possible, Ian, to send that over to Tim, see if he could do a quick review?
There's no way I can have him do a review like that.
Not that.
Not right now, there's
You can ask.
no way.
And-
He's gonna need to see the whole thing in the whole context.
And it will come back to us.
Right.
Yeah, it's gonna come back.
Yeah, he's
Well,
going to
the
go through review again,
commissioners.
so
Yeah.
he'll get it.
This is just one wave.
Yep.
All right. So we're ready for a vote? All right, there's a motion and a second to approve Title VI, Chapter 6.04 with the changes presented by Commissioner Netherland. All in favor, say aye.
Aye.
Opposed? Motion carries. All right. Democracy at work.
Move forward. That's
All right, Ian, I think you're up again.
So, appeal hearing, we have an appeal hearing for La Paulina's #1 permit revocation. This item could be very lengthy, almost 1 o'clock. The hearing that happened before the health officer was almost 2 hours. So there's already been an appeal hearing to the health officer, and then there's this hearing. Just from a employee standpoint, I'm required to make sure that staff have a 30-minute lunch break every 5 hours, and we have 2 staff here. So my recommendation is that.
I don't have time to
Okay.
stay for 2 or 3 hours at this time. Can we schedule a special time?
It would have to be very soon, because we have 30 days to conduct the hearing.
But at the same time, it doesn't have to be as long, but we can. We went long the last time, I was here.
Yeah, I don't, I'm just giving that for context, I don't have any idea how long it would take. But we also have the applicants here instead of today.
Yeah. I know that, I got a quick motion I'll make at the end, that, because we've been through this before. It would be most likely if we hear it, and we hear that, if we find that there's something materially damaging, that's one thing. I myself, I've had a business that was a restaurant, I know that Mr. Nisco has as well. We're positive about one thing when it comes to this staff. They educate before they ever do anything. And if they have a recommendation on how to get them there, if it's even possible, they're gonna tell us that. They told us the last time, and they said, we have a recommendation that if you were gonna do it, this would be the recommendation, and they never complied, did they? That other one, they never actually finished everything you said, so we never.
No, in that situation,
Yeah.
they finished the physicality of the building, and then they sold the business,
Yeah.
and it worked out, and they're open.
Yeah, so I think that's probably where we're gonna end up today, but if you wanted to just at least hear them.
Okay.
But at the same time, we have plenty of people here. If you needed to leave, I don't think there's any issue.
Well, he's leaving
I got
at
a
1.
1:30 meeting, so.
So,
Here, or?
so
No.
I
you'd
can
leave
stay for a
us
while.
to
I think I could zoom in.
3. There's still a quorum.
Okay.
Yeah.
Ned is
There you go.
on Zoom too. Oh, yes.
Yeah.
So, I guess continue.
Maybe we can do it in a short form.
Well, we have to, I have to give staff lunch break,
So
so.
Oh.
people, if they can sit there and there and
We
have
can't.
interpreters
Oh.
here, you're not gonna move
Yeah,
away.
that's the point I was trying to
That's who
say.
that is.
We can't just push on right this
Yes.
minute.
We have a 4 o'clock emergency meeting at the city.
And I have to go back to
No.
work.
at-
I'm paying somebody to stay on there right now.
What time?
Okay.
No, I'm fine.
What time would be back?
We're not gonna violate LNI regulations on camera. It's not gonna happen.
It's not gonna happen.
So do we wanna set a time to reconvene?
I could come back after 2, but I have to be done by
I can come
before
back.
4.
Probably be 2:30
I could
before I
do
get back.
We have a special meeting at 4.
4, so
that we have
as
to
long
be
as
at.
we can be done before
So
4.
2:30 is what I'm hearing?
2:30.
2:30?
Yeah, works for me.
2:30. All right.
I just know we have the people here, I'd hate to send them home.
We're in recess till 2:30?
Recess until 2:30. Okay.
So that I can do it by Zoom, right?
Yeah.
Yes.
Welcome back. We'll continue with,
There's Peggy.
okay. Hi Peggy.
Hey, how are you?
Good. We're just starting. Welcome back, everybody. We are
Yeah.
still in session, and we're going to be talking about, where is it?
Maybe you.
Appeal hearing for La Planido, #1 assessment permit. Is that right?
Yes, La Palomita, #1.
Close enough. Sorry.
All right. Again, Ian Tracy, Environmental Health Manager. We have a translation services here today. We have Alex Graham, she's going to
Can they
be,
move over here?
yes, absolutely.
Would you like this? It might be better for Alex.
There's one for here and then two.
Hi, Sharon.
Look, Record Show, I ran and I arrived.
I had to move down to the end.
I thought we were gonna put them there.
Oh, we'll put them down here, we'll put them down here, that's
Yeah.
all right.
We just won't be able to see.
Alex, let me trade you places.
Sure.
When the music stops, pick your chair.
Oh, there we go.
Duck, duck, goose.
And if there's no chair available, you get to go back to your office.
Should I sit down?
Over here burning a chair. Okay.
So, we have, Alejandro Brown, providing translation, not interpretation. No, it's interpretation, right?
Sure, yes.
Providing
Yes.
interpretation, so please use shorter sentences, leave pauses, so that she can properly translate for us. We also have Sunny Evans, the inspector, our food inspector.
Lost her for a minute. She's next to me.
So the purpose today is to conduct the appeal hearing for the permit revocation for La Poblanita number 1.
El propósito por el cual estamos aquí es para revisar la apelación de la Poblanita número 1.
La Poblanita has been operating in Mason County since January of 2023.
La Poblanita ha estado operando en el condado de Mason desde enero de 2023.
Our inspectors have found the facility to be consistently non-compliant with food safety requirements.
Los inspectores han encontrado que no ha sido consistente con cumplir las regulaciones.
Between July 2025 and June 2026, 8 inspections were conducted.
Entre julio 25 y julio 26, 8 inspecciones fueron realizadas y se cerró el establecimiento 3 veces.
The establishment was shut down 3 times during that period.
Y se cerró el establecimiento 3 veces.
For context, most establishments receive 2 inspections per year.
Para un contexto, los establecimientos requieren 3 inspecciones al año.
The most recent closure was on March 26th, 2026.
El cierre que tuvo más cercano fue en marzo 26 del 2025.
In June, the department received documentation from the city of Shelton
En junio el departamento recibió documentos de la ciudad de Shelton.
The documentation showed that the food establishment owner had constructed without permits
La ciudad de Shelton encontró que el dueño del establecimiento había construido una cocina sin permisos,
a large commercial kitchen and a series of outbuildings at their home.
una cocina comercial que no fue construida con permisos en su casa.
The department issued a notice to the owner on June 26th that the establishment permit would be revoked effective July 6th.
El departamento le emitió una noticia al dueño en junio 26 que el establecimiento iba a ser revocado efectivamente en julio 6.
The owner appealed this decision, and a hearing before the health officer was conducted on July 8th.
El dueño hizo una apelación para esta decisión y se hizo una audiencia con el health officer en julio 8.
The health officer issued a decision to uphold the permit revocation on July 14th.
El oficial de salud emitió una decisión para hizo una decisión para parar el permiso de la revocación en julio 14.
The owner has appealed the health officer's decision.
El dueño ha apelado la decisión del oficial de salud.
Under Mason County Code, the permit revocation suspending the permit will be effective upon a final decision by the Mason County Board of Health.
La decisión final va a ser establecida por el departamento de el, Board of Health.
The facility is currently operating until the final decision is rendered.
El establecimiento está siendo operando hasta que se haga una decisión.
A food establishment that has had its permit revoked is not eligible to apply for a new permit for a minimum of 6 months.
Un establecimiento de comida que ha sido revocado no está elegible para aplicar para un permiso nuevo en un máximo de 6 meses, en un mínimo de 6 meses.
At the end of the 6-month period, the establishment may request a hearing before the health officer to determine if they will be allowed to reapply.
Al final de los 6 meses, el establecimiento puede pedir otra audiencia antes de que el oficial determine si se le permitirá reaplicar.
At the conclusion of this hearing, the board is requested to either uphold the decision, modify the decision, or overturn the decision.
Lo que están pidiendo es que los que están aquí en la Junta hagan una decisión si lo van a modificar, si lo van a mantener o si van a regresar la decisión al oficial de salud.
Would the board like the department to present any of our findings, or have you had adequate time to review the packet?
I think for the public, we should hear at least a timeline, my opinion.
Okay.
Which is in here, but
I reviewed it, but yes, that makes
Do you guys want me to go through this whole entire document for the public? You want me to go?
You can hit the
read
highlights.
through?
I was just thinking the
Okay.
timeline is what I was thinking about.
Okay,
timeline.
all right. Let me know when you're ready,
I'm
Alex.
just gonna start with
Just let her know what we're doing, yeah.
Que se van a pasar las inspecciones que se encontraron de julio 16, 25 a junio 16, 2026.
Okay. So I'm not gonna read the whole thing, but what I am saying is going to be in here, and so you'll be able to find that, because you've seen this before, so. Yep, so, and I'll do it line by line as we go through, but I'm not gonna say every single thing, so you'll pick it up once I start, so. On July 16th, a routine inspection was conducted, and multiple red violations were observed and documented.
Julio 16, 2025, una inspección rutinaria fue conducida y se encontraron varias violaciones rojas.
Critical red violations was 98, blue violations were 8, for a total of 98.
Violaciones críticas rojas fueron 98, azules 8, con un total de 98 en total.
Okay. The food establishment was closed. Education and training on how to correct the violations took place.
El establecimiento móvil se cerró, educación y entrenamiento en cómo corregir las violaciones se le ofreció.
A meeting was held. A training agreement and a corrective action agreement addressing all the violations was implemented.
Una cita
In the establishment.
en la junta, un entrenamiento fue acordado y se le dio una corrección y hubo un acuerdo de medidas correctivas que le informaban sobre las violaciones que se implementaron.
July 18th, 2025, a reinspection was conducted. and the food establishment was approved to open.
Julio 18 del 2025, una inspección fue conducida y el establecimiento fue aprobado para volver a reabrir.
It was noted the active manager control plans and training must still be completed by the listed corrective action agreement date.
Se notificó que el control de manager se tenía que completar y la corrección de el acuerdo de medidas correctivas se tenía que implementar para la cierta fecha dada.
Okay. January 16th, 2026, a complaint inspection was conducted for possible sewage on the ground.
En enero 16 del 2026, una queja de inspección fue conducida por posible aguas residuales en el suelo.
During the inspection, we observed sewage on the ground behind the mobile unit.
Durante la inspección se observó aguas residuales en el suelo detrás de la unidad móvil.
We also observed signs of older areas where sewage may have been discharged multiple times.
También se observó señas de áreas donde había aguas residuales que se habían tirado múltiples veces.
Due to the sewage on the ground and non-use of the approved commissary, the mobile unit was closed.
Debido a las aguas residuales en el suelo y el uso que no era, el uso de no ser aprobada la cocina, la unidad móvil se cerró.
A meeting was held and a corrective action agreement was issued. The mobile unit remained closed.
Se volvió a hacer otra cita y se tomó un acuerdo de medidas correctivas y la unidad se siguió cerrada.
On January 26, 2026, a site visit was conducted after being notified by city officials that the mobile unit was being used during closure status.
En enero 26 del 2026 se hizo una visita y se notificó por la ciudad de Shelton que la unidad móvil estaba siendo usada durante el tiempo que estaba cerrado.
Yeah, I have a question. I want to re-verify what you just said.
Mhm.
They operated it while it was closed? While it
Correct.
was under closure?
Correct.
Okay.
On that specific one, we received, because there are also other jurisdictions that were involved, they were on site and they.
Try and do shorter
Yeah,
sentences.
remember you get the
Sorry, I'm like, I know, I went into answering your question, I apologize, so.
I just wanted to
Yes.
know on that, they were under a closure and they opened up.
So let her translate the
Correct.
question.
So, él está preguntando que quiere clarificar que estaban ustedes cerrados y estaban operando cuando estaban cerrados por el departamento.
And now, if you can answer.
She wants to say.
You answer your question.
Okay, quiere responder la pregunta. She wants to answer the
Yes.
question.
Okay, esa vez fue que cuando ya les había dicho que no estábamos operando la lonchera grande, sino que estábamos sacando las cosas.
Okay, so that time she had mentioned that they weren't operating, but they were sacando las cosas.
Sí, como creo que eran 2 días o un día antes que nos habían cerrado.
No, ¿qué cosas estaban nada más sacando las cosas?
Limpiando.
They were cleaning out the stuff,
Pero no estábamos sirviendo
but they weren't
comida.
serving food.
Thank you.
Because it was a septic issue and gray water issue of where that was going, they were advised they cannot be on the mobile unit doing anything at all, because it was, even with cleaning and stuff, there was no place for that to go.
So, porque se había encontrado aguas residuales en la unidad móvil, se le había notificado que no podían estar en la unidad móvil.
Okay. March 6th, 2026, re-inspection was conducted, and all violations from the closure inspection had been corrected.
Marzo 6 de 2026, la reinspección fue concluida y todas las violaciones del cierre de la inspección fueron corregidas.
Reminders were given about commissary use requirements and that commissary logs must be turned in every Monday.
Se le dieron recordatorios de la comisaría, cuáles eran los requerimientos y que él tenía que entregar las formas de la comisaría cada lunes.
March 26, 2026, a complaint inspection was conducted due to food waste and grease being discarded on the ground.
Marzo 26 del 2026, una queja de inspección se volvió a conducir debido a que las aguas grises y la grasa estaba siendo tirada en el suelo.
During the full inspection, multiple locations were found where food waste was discarded. Non-food, oh, sorry, go ahead.
Durante la inspección, múltiples locaciones fueron encontradas con desecho de comida que fue tirado.
Non-food grade hoses were being used, and there were other red violations.
Ok, mangueras. Mangueras de agua no aptas para alimentos fueron usadas y había otras violaciones.
Red violations equaled 65, blue violations 8, for a total 73.
Violaciones rojas fueron 65, violaciones azules fueron 8, con un total de 73.
The establishment was closed.
Y se cerró el establecimiento.
The owner, manager of the mobile unit came to the office, and corrective actions for violations were explained.
El dueño de la unidad móvil vino a la oficina y las correcciones se hicieron para las violaciones que se le habían explicado.
Reminders were given that the approved commissary is where food waste, sewage, and food preparation is to take place.
Recordatorios de la cocina aprobada es donde la comida, los desechos, las aguas residuales y la preparación de la comida se tiene que tomar, es donde se tiene que hacer.
March 27th, 2026, which was the following day, all corrective actions had been completed and they were approved for opening.
Marzo 27 de 2026, todos los acuerdos de medidas correctivas fueron completadas y se aprobaron para volver a reabrir.
Okay. June 8th, 2026, I received a notification from the city of Shelton that they found a residential property listed under the owner of La Pablanitas with an unpermitted kitchen being used to support commercial cooking.
Junio 8 del 2026, recibió una notificación de la sede de Shelton que encontraron una propiedad residencial bajo el nombre de dueño de la Polanita con una cocina sin permiso que era usada para cocinar comercial, que soportaba la cocción comercial.
On June 15th, I spoke with the mobile unit owner regarding the use of the approved commissary kitchen and the use of the unapproved residential kitchen.
Okay, junio 15 del 2026 habló con el dueño de la unidad móvil sobre el uso de la aprobación de la comisaría de la cocina y de la cocina residencial que no era aprobada.
She stated it was used for an event organization in Tacoma, Pierce County.
Y dijo que se usó para un evento, una organización en Tacoma, en el condado de Pierce.
On June 16th, I spoke with the approved commissary kitchen coordinator and representative.
Junio 16 del 2026, ella habló con el coordinador y representante de la comisaría aprobada.
They stated they can see on the cameras that they enter the location but are unsure of the activities they complete.
Ellos dijeron que, okay, I see here. Ellos dijeron que, is that the second sentence?
Yes, so I just left the name out of the representative.
Okay.
And then, yeah.
So, ellos dijeron que en las cámaras miraban cuando entraban a la locación, pero no estaban seguros de la actividad, de las actividades que se completaban.
The second representative stated they have not used the kitchen much, but this last week, so the week previous to when I had this discussion with them, they had moved in a lot more stuff than before and are using it more.
El siguiente representante dijo que no usaban la cocina mucho, pero que la última semana se habían movido más de las cosas antes de... y la estaban usando más frecuente comparado a antes.
Okay. After reviewing all previous inspections requiring closures and the enforcement policy, I issued a revocation on June 26, 2026.
Después de revisar las inspecciones previas que requieren los cierres y la póliza, le hizo una revocación en junio 26 del 2026.
And that's it for the timeline.
Eso es todo para...
To add context, red violations are critical violations that have a high likelihood of causing illness. Blue violations are best management practices that.
Short sentences, please.
She knows.
Eso, para que se den una idea, las violaciones rojas son violaciones críticas y las violaciones azules no tan críticas. The blue and the red
Blue violations are best management practices. You've got that.
It's probably not in the packet, but it's in the file.
I just want to make sure that they were doing it in
Is
Spanish.
it on the back, right? Okay, no.
Yes.
I have it. I
They were-
probably just don't have it here.
Well, this one in particular.
The revocation notice?
No, therefore.
No, it was a January one.
Therefore,
Oh.
the food establishment must remain closed. You can repeat this. Therefore, the food establishment must remain closed.
El establecimiento tiene que seguir cerrado.
All operations at this location
Todas las operaciones en esta locación,
and inside this mobile food unit
adentro de la unidad móvil,
must stop.
tienen que cesar, parar.
At no time
En ningún tiempo,
is the mobile food unit
la unidad móvil
to be serving,
puede servir,
cooking,
cocinar,
cleaning,
limpiar
or using the unit.
o usar la unidad.
I just want to make sure that they had that one though.
In Spanish. If you go to the O drive and go to food safety, or if you want me to look it up real quick on your computer, I can do that.
And then food safety?
Mhm.
And then where in food safety?
Go, it is
Again, try
establishment documents.
and.
Sorry, I'm just telling him to where to go on the computer to find this document where it was provided in Spanish.
Le dio en español, que está señalando a lo de la inspección de enero, January 25th of
28 of
enero
26.
28 del 26.
Which folder under the food safety program?
Yeah, so if you go.
trying to locate it on the computer.
Está tratando de localizar el papel. y la forma.
You know, for me, that interpretation is important.
La interpretación es importante
And although I know you were there,
y el ser que yo estaba ahí,
I'm looking for secondary verification
estaba buscando la segunda parte para verificar
that it was communicated in your language,
que se comunicó en su idioma.
because I think this is very important.
Porque pienso que es muy importante.
Sorry to do this, I just want to make sure.
Solamente quiere estar 100% seguro que se le comunicó en su idioma.
I don't know if it's got a number on it.
I am having trouble finding that.
Yeah, I didn't have it in my packet. Okay, well, I'll just take that into account. If we-
Está teniendo un poco de problemas encontrando la forma.
Another question,
Otra pregunta.
is this the home one?
Yes, if you are in the documents, anything that comes after the notification from the city, those were provided to us by the city
Está mirando las
with their
fotos de la
notification to
cocina.
them. So,
Entonces, ahorita ya no veo nada que hacer, ¿verdad? Con respecto al permiso, hasta 6 meses después, o ya definitivamente ya no.
¿Puedes clarificar tu pregunta?
Que a partir de ahora queda cerrado el negocio, ¿verdad?
So from now on, is their business closed?
We haven't got there yet.
Aún no han hecho la decisión.
Do we know when, like, the food pictures were taken, were they during a closure, or?
So those food pictures are specifically from the city when
Okay.
they found the kitchen.
Was it supposed to be closed, the food truck was closed at that time?
No, that's
No.
the illegal
what-
kitchen they built.
Okay,
Well, it couldn't have been closed because of that picture.
yeah,
Let's not get too far ahead.
Nada más están mirando las fotos de la cocina y preguntándose si estaba cerrada, pero él está clarificando que no nos movamos más para enfrente, como que no se adelante.
Just for verification, we didn't have any knowledge of this kitchen until we were notified by the city.
Ella quiere verificar que no tenían ellos ningún entendimiento sobre la cocina hasta que la ciudad de Shelton los notificó.
And this is considered a home kitchen, which is not in compliance with code to be serving public from a home kitchen.
Y esa cocina no es considerada, no estaba sorry, can you repeat that again?
a home kitchen
Una cocina en la casa
is not allowed
no
to
está
be used to
permitida para
serve
usar
the food to the
para
public.
servir comida para el público.
It doesn't look safe either, propane tanks inside of buildings.
And, yeah, and that's where
The city closed it down.
No se mira,
Don't jump too far ahead.
Ah.
It hurt.
no se mira
Oh, I just have a question. Where is the approved kitchen located?
The commissary kitchen that they have an agreement with, that they submitted to me.
Let her translate before answering,
Sorry.
please.
Okay, so dice, lo primero que ellos dijeron fueron que no se miraba un lugar seguro. Y la pregunta que ella tuvo es dónde estaba la cocina localizada esta.
¿Esa o la comisaría?
Esta.
It's located at the 40 and 8, which is a local food establishment that has a kitchen that is currently vacant.
La cocina aprobada está localizada en el 48, que es una cocina aprobada.
I have another question. Is there a fee associated with the kitchen use?
I don't know that.
La otra pregunta es de que si hay una fianza, un pago asociado con el acuerdo de la cocina. Yes.
And how much is that?
¿Cuánto les cuesta?
$1,000.
Por mes?
Sí.
$1,000 a month.
Thank you.
That's the rent to use the kitchen.
Yes, that is between food truck and the establishment.
Esa es la
We're not
renta
involved in
que
that.
ustedes pagan entre ustedes y la renta, los $1,000 es lo que pagan
Solo
a la
por usar
comisaría.
la comisaría.
Yes, just use a commissary.
Any other questions?
¿Alguna otra pregunta?
So when the city found the kitchen,
Cuando el departamento de la ciudad les encontró la cocina,
they were already under corrective action, correct?
ya estaban en corrección activa.
Not by public health. They had been operating normally with the assumption they were working out of the 40 and 8 kitchen. So they were not closed at that time.
So, no estaban cerrados en el tiempo que estaban trabajando porque ella tenía el entendimiento que estaban usando la cocina aprobada.
My other question was, is there a reason why you did not use the kitchen? What was the issue?
Su pregunta es, ¿cuál era la razón o el problema por la cual ustedes no usaban la cocina aprobada?
Sí, es que sí estábamos usando la cocina.
She was using the commissary kitchen.
At 40 at 8.
En el 48, yes.
Is she claiming that she was not using this kitchen?
¿Está diciendo que usted no estaba usando la cocina en su casa?
Estábamos usando la comisaría para
They were
el
using the
food-
commissary
ajá,
kitchen
el 48
from the 48
para el food truck.
for the food truck.
En la casa cocinamos porque yo le expliqué a la
At the
inspectora.
house, they would cook because she
Le
explained to
expliqué,
the
ajá.
inspector
Que voy a un grupo de alcohólicos
that
anónimos.
she goes to a AA group
Ajá, en Tacoma.
in Tacoma.
Y ocasionalmente regalo la comida ahí.
Occasionally she donates, dona o regala.
Dona.
Donates food.
Por eso mismo cocinábamos
That's
en la
why
casa.
they cooked in the house.
So you never cooked food that will go on the food truck in your home?
So, usted nunca cocinó comida, es la cocina de la casa para vender en la trailer.
Ok, no. Haz de cuenta que la comida que cocinamos en la casa son como...
So, directa, ok.
Sí.
Es un poquito más directa.
Ok.
Okay. So, la pregunta...
Ok, la comida que hacíamos en la casa es totalmente diferente a la comida que
So
se
the food
hacía.
that she cooked at the house was completely different from the food that she sold at the the mobile food truck.
Sí, porque no es para venta.
Because it wasn't for the public.
Incluso le enseñé fotos a Sani del grupo
And
de la
she
comida.
showed pictures to Sunny of the group with the food.
She did come in the office and when I asked her about that, she showed me the pictures of the group. I did ask if she had a permit in Tacoma Pierce, and she said no.
Cuando usted le enseñó las fotos a ella le preguntó que si tenía permiso para vender en Tacoma y usted dijo que no.
Ok, sí, porque yo no vendo la comida en Tacoma.
Yes, because she wasn't selling it. She wasn't selling in Tacoma.
But you still have to have a permit.
Yeah, regardless
I have
of.
food truck.
Dice que aún así usted tiene que tener un permiso.
Oh, bueno, es algo que no sabía.
She didn't know.
Neither did I. Tell them that.
Dice que él tampoco.
There are a lot more issues in that kitchen, reading these health reports.
Hay más, no problemas, pero otros errores en esa cocina que...
So, Mr. Chair, if we could, what I would love is for give them the opportunity to say their thing.
Absolutely.
And then, though, I would also like to hear the roll-up of why our staff feel they need to do what they're doing. I spoke with her afterwards and was enlightened to a few things, so I'd like to, and I might have the same feelings after hearing what I had. So maybe we can get them to.
To say your statement?
Yes.
Okay, so ahora es el tiempo donde usted puede dar su... porque le puso la nota. Su declaración.
Slowly.
Sí, so si ellos quieren escuchar su declaración, y ya yo les voy a traducir a ellos.
Ok, pues el motivo que por la apelación es pues someterme a lo que ustedes me digan para mantener abierto el lugar.
Okay, someterme para el lugar.
¿O qué necesitan que yo haga para que me mantengan abierto?
So what does she need to do so that she can keep her business operating?
I would just like to hear if they have a different side of the story, and then talk about whether to do that.
Okay, so él dice que quiere escuchar si ustedes tienen quiere escuchar su otro lado de de su historia.
Yeah, is what was said accurate?
So lo que ella dijo es más que nada como verdadero.
Sí, sí es verdadero, sí.
Yes, it is accurate, it is true, what she said.
I have another question. Because in the report, you are given a violation and then you're able to correct it. But there, I'm sorry.
En el reporte se le dio, o sea, tiene otra pregunta. En el reporte se le dio una violación y después usted lo arregló.
But there's a consistency issue.
Pero hay un problema de consistencia.
So what is the issue? Why can't you follow without being corrected?
So, ¿cuál es el problema? ¿Cuál es la razón por la cual no puede corregir?
Bueno, es que sí hemos estado corrigiendo los errores.
So
Ah.
she had been correcting the issues.
Solo eso, que no sabía que podía yo cocinar una comida en la casa
Didn't know that she
y
could.
llevarlo al grupo a donde voy.
She didn't know that she could cocinar una comida como
una sopa o...
Sí, porque es
Okay.
como un acto de caridad.
Okay, so she didn't know that she could make a meal at her house and then take it to al lugar donde lo iba, ¿verdad? To the group.
Intercom.
It's beyond the food making in the home. It is the violations that you have around sewage.
So es más allá que que hacer comida en la cocina, es también se trata como el problema con las aguas grises
And other
y
violations.
otras violaciones.
So where is the disconnect?
So, ¿dónde está la desconexión? Puede preguntar
Okay, lo que pasa
clarificación.
es que como haz de cuenta que yo sentía que eran dos cosas separadas porque usábamos la comisaria para la food
She
truck.
thought it was two separate things because she used the commissary for the food truck.
Y lo que hacíamos en la casa pues no tenía nada
And
que
what
ver
she
con la
made at
lonchera.
the house had nothing to do with the food truck.
But it's more about why can't you adhere to the rules and regulations that are given by the inspector?
For the food truck.
Yes.
So va más allá. La razón, el error, porque no podía seguir las regulaciones del inspector, que tenía que ser con la unidad móvil. ¿Me puede preguntar si no entiende clarificación? Yo les pregunto para clarificar.
Bueno, es que sí estábamos corrigiendo los errores que ustedes me decían.
So she was correcting the issues that was told by Sunny.
But the issue lies is that they constantly have to tell you to correct something, and why can't you do it on your own?
So, sorry, can you repeat the first part?
They have been telling you what the issue
So le han
is,
estado diciendo cuál era el problema
and then you're able to correct it,
y lo pudo corregir,
but then you go back to
pero
the issue.
después vuelve a no seguir las correcciones.
Pero es que sí lo estábamos siguiendo. Lo estamos siguiendo.
So no, sí lo estaba siguiendo o sí lo
Lo
está
estamos siguiendo.
So she is following the corrections.
To an extent, based off the information that is in here.
So, estaba siguiendo las correcciones a un plazo, se le podría decir, pero basado en la información que está aquí.
Bueno, es que entonces no entiendo la pregunta de ella. Porque sí hemos corregido los errores que pues nos han dicho.
Okay, so she doesn't understand your question because they have fixed the issues that were told.
It's the repetition. That's my issue, is the repetition. I'm trying to be fair because you
La
were revoked.
repetición es el problema.
Ok, pero en la última inspección no estamos repitiendo los errores.
So in the last inspection, she wasn't repeating the issues.
The timeline here is a year though. And I don't believe that it should take that long.
So, dice que ella no cree que le tienen que tomar como un año para hacer las correcciones. Basado en la lista. En la lista de tiempo.
I would like to, Mr. Chair, hear from staff of the recommendation and why.
I have one question. I'm curious if the commissary kitchen has been,
Sorry. Le gusta, el commissioner le iba a preguntar al
recommendation
Las
was.
recomendaciones de ONISCO.
My question was, has the kitchen been dismantled now?
La pregunta es si la
Said it was.
cocina se ha desmantelado.
City.
La, no sé.
The home kitchen.
The
The home kitchen. La
O si
comida.
desde el día que el inspector dijo que no lo usáramos, no lo hemos usado ya.
So ever since she was told by the city inspector not to use it, she hasn't been using it.
Yeah, they put a no occupancy. I
Yeah,
knew what
yeah, no, I knew
yeah,
that.
yeah.
Yeah, we were briefed on that a while
Sign
back.
que decía que no podía ser ocupada.
Did they brought that to you at the city?
Yep. Yeah, we knew about it.
I have a few questions.
Okay, tiene unas preguntas.
How long was this business open before the first violation?
¿Qué, después de cuánto tiempo estuvo el negocio abierto después de la primera violación?
So that might be for me.
It might be,
Yeah.
yeah.
So, they were open in 2023. I would have to go back and look at my inspections.
Short sentence.
So, se abrieron en 2023, ella va a tener que mirar las inspecciones.
But they've consistently had
Creo que sí.
violations.
Pero tienen violaciones consistentemente.
This session here has been the consistent and repetitive violations that has moved us through our enforcement steps.
Esta junta aquí es, sorry, can you say that again?
It's this stretch of time here that's moved us
So there's
through,
a
and
loop.
repetitive violations that have moved us through our enforcement steps.
So, la repetición de todas las violaciones es la razón por la cual hemos llegado a esta parte del proceso.
Okay, and my second question is.
Could you?
Okay.
I have a question around June 16th.
Who are we hearing from?
Yeah.
That's Mark Wilhelm.
Una pregunta sobre junio 16.
Hi there, question around June 16th of this year. As I understand, the inspector entered the commercial kitchen location and asked the commercial kitchen representative in regards to the camera. And there wasn't anything on there that would indicate that that commercial kitchen was used. Did I hear that correctly?
We'll let Alex translate and then I can answer.
I had a little bit of hard time hearing the whole
He's
question.
asking for some clarification and detail on the camera situation, because I put a note in my timeline.
Okay, so la persona que está en Zoom está preguntando por clarificación del día junio 16 del 2026 por la cámara. No sé, lo del video.
So,
So, no,
So I'll answer that. So yes, I was offered the opportunity to view video footage from the cameras.
A ella para mirar los videos de las cámaras.
It only went back approximately 10 days, and it only showed the hallway where they enter the kitchen.
Nada más puedo regresar hasta 10 días y nada más se miraba lo de la cocina. No, lo del pasillo.
So I could never verify
Eso no puedo verificar.
details of what was going on in the
De
kitchen.
lo que estaba pasando en la cocina.
Thank you.
Sunny, is it correct to say that the activity at the commissary greatly increased after the city of Shelton closed their home kitchen?
Correct.
Él está preguntando si es correctamente decir que la actividad de la cocina se incrementó después de que cerraron la cocina con la residencial. Y Sunny dijo que sí, correctamente.
And also on July 16th, staff and the food truck said the beans were made at the owner's home and then brought over to the truck.
Y también en
How do we
julio
know that?
16 se dijo que los frijoles se cocinaron en la casa se cocinaron en la casa.
And now I'm asking staff, How do they know that?
Y él está preguntándole a los demás de cómo saben que la información es, cómo saben pues de que los frijoles se hicieron en la casa.
The violation observation, and this was by our previous inspector.
La inspección que se le hizo,
Her notes say that the staff on the truck stated they came from the owner's home.
so la inspección que se le hizo, le preguntó a la persona que estaba trabajando y la persona que estaba trabajando contestó que se habían hecho en la casa, se habían hecho cocinado en la casa.
I was wondering if the food handlers permits for everyone involved have been up to date since they opened in 2023 continuously.
Ella quiere saber si los permisos para cocinar para el público han sido renovados desde el año 2023.
Yes.
Yes.
Yes, okay. And then also with that, and I don't know who has this answer, but did they apply for a business license before they opened? And
Que si ustedes aplicaron para una licencia de negocio antes de abrir
and has it been current
y
continuously?
si ha sido, si está actual. Sí. Yes.
And we have verification of that?
You would have to ask the city of Shelton for that information.
Wasn't there something in there though where they didn't have their, okay,
Yeah.
please express.
So, in response to the food worker card question,
So, para responder la pregunta de las tarjetas de comida,
active manager control is a secondary training that the owner operator is required to get.
el certificado de gerencial es un certificado que están requeridos a obtener.
They did not have that for a while.
No lo tuvieron por un largo tiempo.
When a lot of violations started coming, we used that as an enforcement, and she
Cuando,
did get that.
cuando las varias violaciones empezaron a ocurrir, después fue cuando usted obtenía el certificado.
During the first enforcement,
Durante el primer,
we also set up a training guide
durante la primera inspección que tuvieron, se les provió un entrenamiento
that we requested her and her employees to go back through their food worker card manual
que le pedía
and
que
retrain on these things.
no sé si recuerda marcado de fecha que se le proveyó y sorry, what was the last part?
Review training.
Tenía que revisar el entrenamiento.
And then I have another question. Has the truck moved locations or has it stayed stationary continuously?
La unidad móvil ha estado parqueada ahí o se ha estado moviendo.
Desde que nos dijeron que lo teníamos que mover, lo hemos estado moviendo.
Ever since they were told to move it, they have been moving it.
I'm gonna add to that. So their food truck has a base location where they serve food.
So, su unidad móvil es una unidad móvil que tiene una locación básica.
Through the enforcement, we have made sure that they were educated that they're required to move that truck back to their commissary
Durante la
to do the
educación
things
se le
they
dijo que
cannot do
tenía
on
que
site.
moverla para la comisaría, para cambiar, tirar el agua y todo eso.
Thank you.
Anyone else? Staff?
Some of the violations
Algunas de las violaciones.
Had to do with food temperature, food handling.
Tiene que ser,
Is that,
algunas violaciones tienen que ver con la temperatura y cómo hacer las cosas.
is that being addressed?
Eso es algo que se está corrigiendo.
Sí.
Yes.
And then Randy asked if staff could give some more information.
Might ask for Peggy if she has any questions, she might.
Preguntar a la
Peggy,
otra persona que sí
Do you have
tiene
anything?
preguntas.
No, I don't really. I went through all the material. I don't really have any questions.
No tiene preguntas.
Randy, you have more questions?
No, my question was, I'd love to hear staff's presentation.
So, no tiene preguntas, pero él quería que la staff que viene siendo ella presentara el caso.
Of their requested action
De la acción correctiva.
and why.
¿Por qué?
Explain to them, we've done this before,
Lo han hecho antes
and staff has usually been flexible.
y se le puede decir los trabajadores han sido flexibles
And if they're not,
y si no,
that carries weight,
eso le pone
and I want to know why.
y él quiere que sepa por qué.
The challenge that we have in this situation is the repetitive nature of the violations.
El obstáculo que se mira varias veces es la repetición de las violaciones.
It's hard to recommend giving someone additional chances when we've given them so many chances for the same issues over and over again.
Es difícil recomendar, dice recommend, sorry, can you say that again?
It's hard to recommend
Es difícil
more
recomendar
chances
más
when we've already given
chances
many chances.
porque ya se le
for
dio
the same
varios
issues.
chances y por los mismos errores.
The construction of the commissary at their home
La construcción de la
showed
oficina comercial
a large investment in non-compliance
demuestra que
For
no
an
estaban
issue.
siguiendo las reglas
for an issue that has been a chronic problem with their facility.
por un problema que ha sido grande para su unidad móvil,
Which is failure to use their commissary.
que viene siendo la falla para no usar la comisaría aprobada. Es un fallo.
Is it safe to also say, because of the conversation we had after, you have a belief that they will not comply as readily as
Letter translate.
Okay, dice que si es seguro decir que ella, I'm sorry, can you repeat that again? Is it safe to say that
their belief is
su creencia es
they will not
que
comply.
no van a seguir la regla?
My words
Sus palabras
may be truthfulness
tal vez es honestidad
is that issue.
con ese error. Y pregúnteme si no lo entiendo, si no me entiende.
Yes. Myself, Alejandra, as my translator, she's been with me on all the inspections.
Y dice que sí, que yo he estado con ella en todas las inspecciones.
We've provided physical showing
Le hemos
of compliance on violations.
Le hemos proveído físicamente
Like demonstration.
las demostraciones,
Documentation,
documentación
and corrective action agreements.
y correcciones activas.
Throughout all of these closures, that has taken place every time.
Durante todas las veces que se le han cerrado.
Due to the lack of active manager control,
Debido a que no tenían la información del Active Manager Control que viene siendo, usted sabe cuál es ese certificado.
and the repeat red violations.
Las violaciones repetidas.
I recommend from myself
Ella recomienda que
to uphold the revocation. Did you get that,
I'm having a
Alex? Are you having a word?
Yeah, her personal
Or
recommendation.
professional
is to uphold.
recommendation is to uphold the
Okay, so-
revocation.
Let me just find it because
That's
it's
okay.
too much.
Yeah.
I have a question for the interpreter who has accompanied the inspector. I heard that correct, right?
Correct.
In your observation, is there a cultural or a language or a deficit that doesn't allow?
Mark, could you hold on a second?
So está un poco espantada, como después de mirar todo, está un poco.
Okay. Are you good for Mark's question?
Yeah.
Okay. Go ahead, Mark. Alex is ready for your question.
Hi, Alex. My question to you is, when you accompanied on these inspections, in your opinion, did you come across maybe a cultural aspect to in not being able to comply?
Short sentences.
Can you translate to that?
Sorry about that.
Yep.
Okay. Okay, so la persona que está ahí está preguntando que en las inspecciones que si usted encontró un problema como con las tradiciones. Go on.
Go on.
Go ahead, Mark.
And so my question is around the ability to understand. What I'm seeing here is, if there's not cultural or language barrier to complying, I'm seeing this as more of a willful. And that's what I'm trying to get to. Is there something that's preventing outside of
Short sentences.
not complying? Oh, sorry about that.
Okay, so dice que la habilidad para entender si no es cultural, como para seguir el reglamento, si hay algo más. You can go on.
So he's asking you, Alex.
Me. Yes. I'm sorry.
No, it's okay.
Okay.
It's okay.
Just making sure that they get to hear what's being said.
Yeah, what the question is to you.
Do you feel you've had good communication?
Yeah, sorry, I was just thinking of translating, not thinking.
Do you think you had good communication? Did they understand you? Is there a culture barrier?
Okay, so yes, I do believe that there was some communication where I found myself that they weren't understanding me, and then I would use different examples to explain what I was saying, and then after that I would ask them again if they needed me to use a different example so that they could understand when I was translating for her.
So you found issues, but overcame them.
Let her translate.
So me están
I wanna
preguntando
make sure
a mí
they-
que si yo pienso que ustedes, el problema era de que había como un entendimiento cultural por el cual ustedes no comprendían la información. Yo les dije que cuando yo iba con ella a explicarles, yo entiendo que había como un problema de lenguaje, pero que usaba ejemplos para explicarles y les volví a preguntar que si me entendían y ustedes decían que sí.
Bueno, creo que todos los errores no son consecutivos. Creo que todos los errores fueron saliendo algunas veces o eran unas, luego las otras y así, pero no.
Okay, poco a poco.
Okay.
Okay, she says that she does, que no, usted no piensa que los errores eran consecutivos.
Yeah,
She doesn't think that the issues weren't consecutive or repeatedly. ¿Hasta qué eran después de qué?
Así no que cada vez encontraban un error
So every
y
time they would find an error,
lo arreglábamos.
she would correct it.
Ajá, y volvían a ir y encontraban
they
otro
would-
error diferente.
They would go again and they would find something else, another issue, they would find something different.
But they all had their food handlers from it, so they all took the tests and they all had read the books.
So todos ustedes habían tomado el entrenamiento para los trabajadores de comida y todos tomaron el examen y todos leyeron la información. Yes.
And there's a certified manager on property.
Yes, Gloria holds a certified, that was a
Y
requirement.
ustedes, la persona certificada con
Well,
el,
they didn't for a while.
pero no lo tenían por mucho tiempo.
Nope. You can't have conversations without her having the opportunity to translate.
Thank you.
Do we have any more questions, comments?
¿Preguntas o comentarios?
Or does anybody want to make any motions?
¿Alguien quiere hacer una moción?
Bueno, pues solo, bueno, eso que tengo que hacer para mantener abierto el negocio, no puedo hacer nada.
That's her question is, can she do anything to keep her business open, or can she not do
Después de pues
anything
corregir todos los
after
errores.
she corrects all the issues, all the errors?
Sí, pues de un tiempo de que corregimos todos los errores, yo creo que todo está en regla, desde la food truck, la comisaria, todo en regla.
Todo está en regla. ¿Desde cuándo?
Desde que fue el último
So,
error. digamos.
so ever since the last time que los inspeccionaron.
Ujú.
So ever since the last inspection, everything has been corrected.
Sí, porque salía algún error y lo
Because there was
corregíamos
an error and they would fix
al
it
momento. Y
immediately.
nos comunicábamos
at the
con
time.
ustedes para...
They would communicate
que lo
with us
verificaran.
so that you could verify.
Entonces creo que sí hemos tomado cartas
So therefore,
en nuestros
he thinks
errores
that
y
they did
corregirlos de inmediato.
correct, espérame, que sí corrigieron los errores.
Sí.
Okay, that they did correct the issues. the
After the
errors.
revocation?
Después de la revocación,
No, más antes,
before that,
tiempo y atrás.
like before, way before that.
When you look at these closures,
Cuando
the
mira
main
los
thing that is
cierres.
repetitive is the lack of use of a commissary kitchen.
Cuando mira las inspecciones, las violaciones, lo que falta es las repeticiones, es lo mismo que no usan la comisaría aprobada.
Within that statement of not using the commissary, that involves food coming from a home kitchen,
Con eso que ella acaba de decir, lo que involucra a no, lo que involucra a traer la comida que está hecha en casa,
water source
el agua,
not being used, and
que
food
no
grade
se
hoses,
usa, las mangueras de agua que no son usadas.
Okay, pero
sewage on the ground,
Las aguas grises en el suelo,
and then the other food safety violations on the truck.
y las otras
Those are
violaciones de comida en la unidad móvil. Can she say
Yes.
something?
Okay. Hemos estado usando las mangueras de agua ¿qué es para eso?
They have been using the gray water hoses for that.
El día que fueron a inspeccionar,
The day they
Ah.
went out to inspect,
había una manguera corta negra tirada
there
ahí
was a black hose outside
que
on the
no
ground.
era mía, era de la
That
tienda.
wasn't hers, it was from the owner of the store.
Y yo les dije ese día, Que esa manguera la usábamos nosotros de vez en cuando, pero era para mapear.
And she told them that that hose was used to get water for the mop.
Pero le digo, bueno, la manguera que nos dijeron que usáramos era la que hemos estado usando.
But they have been using the gray water hose.
Yeah, I mean, I can,
You don't have to.
yeah.
Yep, I think that we're probably at the point of, oh,
I just had one,
Yeah.
one question. Do they think that they've understood from their perspective, have they understood?
So él está preguntando que de su perspectiva, ¿ustedes creen que han entendido?
Sí.
Yes.
I think,
Estamos dispuestos a que, no sé, lo más pronto puedan ir a hacer una inspección y adelante, no hay ningún problema.
Okay, so they are open for an inspection and they're ready, there's no problems.
Sí, para que verifiquen
So that
que
you
está
can
en regla,
verify that
pues,
everything is in regulation.
I think we're past that.
Dice que él piensa que ya están como más pasado, como están más, como ya no es una opción, por ejemplo.
No entiendo.
He doesn't understand.
We're deciding whether you can open back up. That's what we're talking about right now, not inspections or,
Okay, so la razón por la cual están aquí es para decidir si pueden seguir operando. No pueden regresar como para inspeccionar.
I'm gonna ask the board right now to make a motion to recommend one way or another.
Va a pedirle a los que están aquí que hagan una moción para recomendar si escogen un lado o el otro.
I move to make a motion to uphold the decision made by the inspector.
Second.
Right, any more discussion?
¿Qué fue lo que dijo?
¿Cómo?
¿Qué fue lo que dijo?
Can you clarify, she said?
Me?
No. She made a motion to uphold the permit
To
revocation.
uphold.
Yeah.
So,
For it to stay closed for,
For to be closed for a minimum of 6 months.
okay, so la decisión fue de que lo van a mantener, lo van a mantener cerrado por 6 meses.
And we had a second.
Y la segunda persona que votó en favor fue,
And now we'll vote.
y ahora van a votar.
Motion and a second to approve staff's recommendation for 6 months. All in favor, say aye.
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 Opposed? The motion carries.
That was for
Revocation.
the revocation. Esa era para la revocación, so votaron para revocarlo. Si tiene preguntas, es el momento. So revocar. So she's asking, what revocation?
There-
Revocation, yeah,
Oh.
revocation means her permit is terminated and she cannot apply for a new permit for 6 months.
So la revocación significa que los van a cerrar y no puede reaplicar hasta que pasen los 6 meses.
And that decision is effective 10 days from today.
Y la decisión toma efectividad de 10 días desde como en esos 10 días. ¿Preguntas?
Ok, trabajaremos todavía 10 días
So they can still work for 10 days.
y ya cerramos.
Sí. And then they have to close.
Mhm.
Alex, they'll receive official notice with the board's decision.
Y van a recibir una notificación del Departamento de Salud con la decisión determinada.
And they can apply in another county.
Pueden aplicar en otro condado.
Tengo unas preguntas.
Okay, she has some
Okay,
questions.
tenía una segunda lonchera abierta, era la Poblanita 2.
She had a second, ¿era una unidad móvil?
Ajá.
She had a second
Tenía abierta, pero
mobile
había
unit,
ido, ajá.
Poblanita number 2.
Good question. I don't know the answers to that.
That's a decision that we have to discuss with the director in
So
the
esa
future.
decisión va a ser discutida con el director. Bueno, no terminó la pregunta. ¿O sí?
No, es que como, ¿sí te
You can
acuerdas
go,
que
Mike,
tenía
walk
abierta
down.
la otra lonchera?
Ajá, la que vendió.
Ajá.
They have a quorum.
Ok, metí los papeles de la aplicación para otra lonchera.
¿Con nosotros?
Sí.
So she submitted the documents for the second mobile truck
Mm-hmm.
for La Planita 2, for Poblanita number 2.
Mm-hmm.
Okay.
Ok, esa sí puedo abrirla.
Can she operate that one?
That
No-
is,
No permit has been issued for that.
No hay un permiso que sea aprobado para esa.
it's gonna be discussed further with director before we make a decision on the process that we're supposed to take by,
So se va a
For code and stuff.
discutir con el director, porque tiene que ser procesado, tiene que ser una junta entre ellos para ver qué van a decidir.
Sobre esa aplicación que metí.
Based on that application that she submitted, right?
correct?
Yes. Sí.
She can have further conversations
Yeah.
with the director.
Usted puede tener conversación de esto con el director.
So, Mr. Chair, I move we adjourn.
Do we have any, I think we skip any other board discussion really quick? No. All right, motion to adjourn.
So moved.
All right, second? All right, we're adjourned.
All right, when's our next meeting?